So we're going to go ahead and turn that on. Okay, so my name is Karen Duncan, and I'm with Region 5. On behalf of Region 5, Western Tidewater CSB, I would like to thank you for attending Identifying and Treating Trauma in Men, presented by Dr. Phillip Riddick. So there's a few housekeeping rules to keep in mind. I'm going to be monitoring the chat. There'll be a few breaks throughout the training, and you must be present for the entire training to receive the certificate of completion. This training is going to be recorded, and at the conclusion of the training, if you can send me a message, direct message me with your email, your first and last name, and the agency that you work for, so that we can get you the certificate. And at this moment, I would like to thank you and pass it along and introduce you to Dr. Riddick.
Good morning, great people. It is good to see all of your faces. I appreciate you sharing your Thursday morning. Thursday morning with me. You can tell what kind of week it's been for me. And so we're going to do we're going to learn some things today. We're going to have some fun. I'm sure you all are, as we do in this field, juggling many things at one time. So I do appreciate, just your effort in being attentive and present here in the moment, as you always tell your clients, right? Just be present, be in the moment. You have to try that too. I am not a lecturer, so I appreciate feedback. I appreciate questions. I appreciate you sharing some of your own lived experiences. I know Ms. Duncan is going to be reviewing the chat. So, we have quite a few people here. So just kind of jumping out there probably isn't the best thing, but if you throw something in the chat or raise your hand or do something like that, Ms. Duncan can help me out with making sure that your voice is heard in the appropriate times. So, I guess I have to do, I'll start with sharing my PowerPoint. Are y'all seeing anything? Thumbs up, thumbs down? Y'all are seeing it? Okay.
Yes.
All right. So, identifying and treating trauma. So that is me, Dr. Phillip Riddick, licensed clinical social worker and certified clinical trauma professional. So the learning objectives for today. One of the first things I'm going to say we're going to do is, after completion of this training, learners will show the ability to describe the impact that trauma has on the brain and the body. We're going to identify some of the stressors that men face. I'm going to differentiate between a non-compliant client and a disengaged client. We're going to demonstrate the ability to engage with male clients who have encountered trauma. And we're going to implement trauma-informed interventions that are engaging and person-centered. So those are our objectives for today. Hopefully you will have the ability to do all of these things by the end of our time together. So I was told I had to do my own introduction, and it's very cringy for me. I don't like to talk about myself. And so I had to give myself talking points to make sure I hit all the key things. So who am I? Like I said, my name is Dr. Phillip Riddick. I am a native of Norfolk, Virginia. I was born and raised here. I left when I joined the Marine Corps and provided my Marines out here, and ended up coming right back into this area and jumped into this field. What have I done in the field? I've started working out in foster care. Did that for a while. I realized that being in court 3-4 days a week just wasn't for me. Court makes me nervous. Even if it's not for me, court just makes me nervous. It's, we can talk about other things, the reasons why that's the case. But yeah, court just makes me nervous. So I can't be here. So I ended up doing some in-home counseling. I did that for a while. Worked at psychiatric hospitals. And in the typical circuit of things that we do, our group homes and case management positions and stuff like that. Did some of those as well. Then started doing more administrative positions and was the assistant director of one of the group. I'm sorry, assistant director of I think somebody got the audio still on. Assistant director of the community-based agency. I was a clinical director at Virginia Beach site for a while. And then I recently opened up my own practice in 2021.
That's what I need to get.
Can everyone please make sure that they're muted? Thank you. I'm sorry to interrupt.
Yeah, no, you're good. I was seeing if I could do it, but I can't. So what do I do for others? So right now, like I said, I have my own private practice where I work with individuals and couples centered around trauma mostly. And so we're talking about everything from, having traumatic experiences overtly to recently, as I completed my doctoral studies, I've been doing some transgenerational trauma as well as assisting with co-parenting intervention. So the co-parenting portion, which I think me and Ms. Hatfield have been talking about possibly bringing that as a future training. The goal with that is to point out the emphasis and need for parents to have the skills to parent together. Because the way that the system is currently set up, it's like, all right, everything is me against you. And we just got the kid in the middle that I want and you want. And so we're just fighting to the death, right? But the goal is to have this co-parenting intervention that, they can learn how to work together and mitigate the need for the court system so that they can be better parents and be there present for themselves as well. And so lastly, what do I do for myself? I'm a foodie. I love to eat. I've been to most, if not all, the restaurants in Norfolk. I will tell you, had I known that doing that, I could get some tons of social media followers and eat free all the time, I would have done that a long time ago. But we live and we learn. But I'm a foodie. I love live music. I love comedy. So those are places you can find me: comedy shows, concerts. I'm your guy. So this is where it gets fun, Ms. Duncan. We're gonna see what Zoom really can do. Cause I wanted to do a little icebreaker for everyone, right? But we have over 100 people here, so it's gonna be difficult. So I think we're gonna try to just see how many people. Look, no more than was about 5 people right per room. We're gonna shoot for. All right, so yeah, we're gonna shoot for about 5 people per room.
We have 176 participants, so we're gonna try to break
so we'll
it
see.
that way.
If it doesn't work, we'll scrap it and move on to something else. We'll try something else. But what I want you to do is, in your group of 5, I want you to identify one thing that you all have in common that is not work related. So one thing that all of you have in common that is not work related. And then I want you to come up with a list of 3 differences experienced when working with men versus working with women. Assuming that you all have worked with both men and women, right? And so I want you to identify one thing that you all have in common, and then together come up with a list of 3 differences that you experience in working with men versus working with women. And so we'll see how Zoom does with this, with the 178 people, and as the number continues to grow. And we'll come back in about, let's say, 8 minutes. So everybody goes around that. We'll go from there.
You all, let's see how many breakout rooms it can create, y'all. It's working. What's happening? All right, and we're gonna put you in breakout rooms now. So there should be an invite. You have 35 breakout rooms. Just that'll make it like 5 or 6 people in a breakout room. And you
so
just
you and I
are up to 180. No. Did you want to go into one?
No, I'm good. I'm sure they don't want to hear from me. They're going to hear from me for 4 hours.
And how long did you want them to have?
Let's try like 8 minutes, I guess.
Okay, so I'll give them a little message. All right, we still have people coming in, so I'm gonna just pop them into rooms.
Okay. If I put it in the chat what they're supposed to be discussing, it won't go into their rooms, will it?
I can do it. I can broadcast it in. Did you want me to
Okay.
write something to them?
Yeah, I guess the things that the two things they're supposed to be discussing probably would be good, especially for people that's just coming in.
Okay. Some people are putting their answers in the chat. But she's compassionate, so now we know.
That's right. That's right. Number one.
Mm-hmm. There's more people.
Okay, so I was the guinea pig to test if whether or not if we broke out of the breakout room, would we come back here? So this is my group kind of showing up right now.
Broke out. Oh, that's funny. Yeah.
we didn't know what the button would do, if it would kick us completely out.
So
or
we
not.
should have added bravery to our list too.
Yeah, we should. Yes,
There
we
you
should.
go. There you go.
I would go with
Lead-
rebel, but bravery works.
Oh, rebel.
Leadership from the front. Leadership from the front.
We're the creative team.
I like it. I like it. I still have people coming in that I'm just popping into random rooms and they're not going to know what in the world is happening.
I've got to relocate to another room. I'll be right back.
Okay, great.
Okay.
Okay.
Do you want about, I don't know where we are with time.
I guess you can give like a 2-minute warning, I guess.
Alrighty, we will do that. Oh my goodness, there's still more people coming in.
Oh, wow.
Yeah, I'm probably not gonna keep moving them or they're not gonna know what in the world's happening.
Right. Yeah.
All right, are you ready for me to bring them all back?
Yeah. My thing, my control panel. Oh, there it is. Never mind. All right. Yep. I'm good. I'm ready. I lost it for a second, but it just hit itself.
You are at, just so you know, 186 people.
Okay.
That's impressive. All right. They get that 60-minute or 60-minute, Lord, 60 seconds.
Okay.
And then it automatically closes and brings everyone's back in.
The whole what they call it, the Zoom rapture. Bring them all in.
Forever now, I will put my head in that. That's funny.
Gotta be careful for that for Zoom rapture. It'll get you mid-sentence. All right.
Recorded.
Everyone is almost back.
Everybody's back.
We got about 50 people left.
Okay.
I guess it takes a minute for them all to come back in.
My Verizon is going in and out, so if I black out my screen, it's just because it's stuttering a little bit.
Okay, thank you for letting us know.
No problem.
Okay, I think everyone is officially back now. Welcome back, everyone.
Yes, welcome back. Welcome back. Hopefully you all learned some great things about each other. So we have people from all over. I was looking through the chat while you guys were in there. So we have people from all over. I appreciate y'all spending some time with us. So if I can get just a few people to share one of either an important thing or a funny thing that they found that they had in common with their other group members, We'll start with that one. Who wants to share number one first?
So
I'll
I can
start.
go. We're talking about the things that we have in common. Obviously, we are mental health professionals, and we all like
Mhm.
pasta.
Good people, my people. Y'all are my people.
Thank you.
Thank you, thank you.
Our group had in
Who
common
else?
that we were all women and that
Okay.
we liked music and we all wore glasses or contacts.
Nice, nice. Thank you, thank you. We'll do one
And
more.
our group found out that we like music, especially karaoke, doing karaoke.
Uh-oh, that's some singers. That was a singer group. Y'all gonna perform for us during the break. So
I don't know
get ready.
about that.
All right. So next one, you're supposed to talk about 3 differences experienced when working with men versus working with women. So who would like to share? That few people can share that.
We were group 20. Our group noticed that the difference sometimes with working with men and women tend to be more emotional, and a little bit more needy as opposed to the men.
Okay. More emotional, more needy as opposed to men. Okay.
Hi, I'm Deb from Group 19. We talked about several, but there tends to be less services in the community for men, and also you think that men prioritize work versus their mental health. Women are more open to that, they're more apt to talk about it.
Nice. That's good. Good. So less services available to men. And that men prioritize work over their mental health. Good stuff.
In group 25, we found that men seem to be less kind of verbal or articulate around what their emotional experience or pain looks like. And similarly, maybe female clients or students maybe more consistent in attending and showing up for their mental health, whereas guys seem to be more guarded or more kind of like deflecting with humor.
That's big, right? So you said a lot of good stuff there. So deflecting, that's huge, right? How we kind of process and deal with it, with the trauma or experiences that we have. Also, like you said, showing up, being more consistent with it. So you found that to be more prevalent with women and more difficult to articulate what they're going through. Nice. Who else? We'll do 2 more people.
I'm not really sure what group we were in, but so we recognize the fact that men have have a lot more pride. So that makes them, they don't want to share so much because of their pride. Takes longer to build rapport with men. And I wrote down something else. They're also braver.
Okay.
Yeah, and they seem to be also be a little bit more directed in some areas.
Okay.
Not so much
some areas.
mental health.
Gotcha. Okay.
Group 27 put in the chat that they were not all born here, but they moved here, which is interesting. Men seem more guarded, less likely to open up about their feelings in groups or therapeutic settings than women.
Okay. Thank you all. How was that? Having to kind of come together and actually talk about? That's really something that we don't talk about often, right? Is the differences of working with men and women. I know from my own experiences, right? We haven't talked about often because it was very rare that we saw men. That I see men in many of the spaces that I worked in until I started doing my own private practice. And so, as I hear some of the things that you're saying, right? Men have less services. They aren't able to articulate their emotions in the same way. More pride. Takes longer to build rapport. I think it's important for us to make sure that we are able to take these things into account and incorporate them into what we do. Ms. Robinson, how you doing this morning?
I'm doing good, Dr. Riddick. It's good to see you.
Good to see you.
And so what what we also found, which kind of was a little bit different, was we recognized that when men feel more comfortable, when they feel comfortable, because society acculturates, simulates, causes them to have an external exterior that's a little bit harder for various reasons, as you know, that they are more inclined to open up. And when they really open up and feel trustworthy, like they feel that you're trustworthy, they're more expressive and they feel free to communicate. More so than women.
That is a great point, right? And I think the key word that you said there is trust, and we're definitely going to get into that. But think about the SAMHSA's tenets to creating a trauma-informed environment, providing trauma-informed care. That's one of those things. You have to create a safe space where trust can grow, and so that is very big and important when working with anybody, but we are talking about men this morning. So I appreciate all of you and your participation in that. So, few disclaimers I want to put out there. First and foremost, right, for the purposes of this training, we are specifically talking about cisgendered men. And so, there may be, I don't know what future trainings will be had for any other populations, but for right now, for this day, we're talking about cisgendered men. I understand, as you all do as well, nothing is absolute. So we're going to be painting with a broad brush many times throughout this training, but we do understand at the same time there are some exceptions to every rule. So even with these things that we see, we may have worked with men who are able to articulate their feelings a little bit better, or not everybody's experiences are the same. Also, we may discuss some sensitive topics. So if we do, and if you need a moment, that's fine. Take your time, cut your camera off, take a walk, if that's what you need, because we may come across some things that may be triggering for some people. And last but not least, I do make corny jokes. Prepare yourself, because it's going to get a little uncomfortable. So we're going to go ahead and get started with a quote from Ms. Sandra Bloom. Understanding trauma is not just about acquiring knowledge. It's about changing the way that you view the world. Understanding trauma is not just about acquiring knowledge. It's about changing the way you view the world. So I love this quote. And, for practitioners like yourself, I think it's really important for, y'all got me comfortable. I'm not even looking professional. I forgot this is recorded. Let me sit up straight. Sorry. So practitioners such as yourself, right? It's important for us to remember that we're working with people who have lived experiences that have taught them that the way that we live the world, typically, right? So I'm saying typically the way that we live the world is not safe. So they've established a safe way that has caused them to find some what we call as practitioners maladaptive ways to deal with the world around them. But the reality is, if we change our view, once we start to understand and acquire knowledge about trauma, we understand that we have to change the way that we view the world, right? It's not just the person. It's for those that's read What Happened to You, right? Oprah and Bruce Perry, changing the perspective from what's wrong with you to what happened to you, right? And that understanding that, your behaviors that you're presenting to me are just a set of ways that you've learned to adapt and deal with the world, and really change the way that we view the world, change the way that we do the work that we do. So that is a very important thing and a great quote I like to look at. So trauma sting as told by the expert, right? Everybody, I'm sure most of you have heard of Bessel van der Kolk. If you have not, he is the author of The Body Keeps the Score and one of the leading voices in trauma. And so here's a quick blurb of how he discusses how trauma impacts us.
Yeah.
Can't hear it.
Sound?
Can't hear it?
No. No audio.
Uh-oh.
You could share your sound. I don't know if you've done that already.
I probably haven't. how do I share my sound? Where do I go for that?
It should say view options, and then there should be a tab that says share sound at the bottom.
Microphone, speaker, audio
I noticed too
settings.
that I have to mute myself if I'm sharing a video.
Okay. All right, so let me try muting myself.
View options is at the top.
Yeah, that's where I'm at now, looking at the options, making sure that share computer sound is connected.
Let's try to see.
Trauma is something that happens to you that makes you so upset that it overwhelms you. There is nothing you can do to stave off the inevitable because you are unable to function in the face of this particular threat. But the trauma is not the event that happens, the trauma is how you respond to it. One of the largest mitigating factors against getting traumatized is who is there for you at that particular time. When, as a kid, you get bitten by a dog, it's really very scary and very nasty. But if your parents pick you up and say, "Oh, I see that you're really in bad shape, let me help you," that dog bite doesn't become a big issue because the foundation of your safety has not been. Trauma is something that happens to you.
So what I want you to pay attention to there, and remember as we go through this training, we'll come back to it, right? So he describes trauma as like a not just one event, but how we respond, like and the things that go along with it, and the way to get through it, or the thing that makes it not as traumatic, is the response that we receive, or the support that we receive to that precipitating event. Like I said, the dog bite, if you have somebody there to say, "Oh, it's okay," to kind of help you with it, then it isn't looked at as such a difficult thing. So as outlined by the American Psychiatric Association, they're saying the question is, what is trauma? So it is an event that one experienced, witnessed, or took in through vicarious exposure. So experienced, obviously, you actually were there, you went through it, a traumatic car accident or any types of abuse or neglect. Witnessed, so you saw someone who went through maybe one of those same things, or you took in through vicarious exposure. So
Donna
that
gets
vicarious,
so many emails that when I email her,
that vicarious exposure can be anything from, especially nowadays, right? Think about all the things that you've seen over the last few years with social media. A lot of the nowadays you can't go on social media without seeing like some type of fight, or and now they even showing people that are being murdered. Think of George Floyd, even going back to 9/11, right? Even watching the Twin Towers get crashed into, right? Those things can create a level of trauma from that vicarious exposure. And so a lot of times people feel bad, right? It's like, oh, well, why am I impacted by
How's your day going, Hank?
this thing, this person who I don't even know? A lot of things, that's something a lot of people experience, but that vicarious exposure still can elicit a traumatic response in us. Number two, if trauma presents a threat to the physical or psychological safety of oneself or others, and that threat can be real or perceived. So the physical or psychological safety of oneself. So at the end of that video that Dr. Vanderkolk was just saying, right, what happens after that trauma happens, if we have someone to help us through it, if we have someone that can say, hey, you know what, this happened, this bad thing happened, but we're going to make sure it doesn't happen again. That lets us know that we are safe. It helps us to get through it in a way that we aren't painting the world with that broad brush. Versus if we don't have that, now everything becomes a question of whether or not we can trust it, whether or not it's safe. And then lastly, is the APA said that trauma creates a response of intense fear, helplessness, or horror. So for all of you that do diagnosing, you know, for PTSD, there's two things that you're going to look for, right? Arousal and avoidance. And so that avoidance can be that intense fear, helplessness, or horror, or, you know, I'm not going to go to this place. I'm not going to go to this person's house. I'm not going to, I don't want to do these things because of the response that I have. Now, let me back up for a second because I forgot to give you guys kind of the outline of today. So we're going to start off talking about trauma and just some foundational trauma things. I'm sure most of it you'll probably already know. So we're not going to spend a lot of time on it. I just want to kind of make sure we're all on the same page and up to speed on where I'm going with it. So we're going to talk about trauma, and then we'll take a break and we'll go into talking about some men issues and how to work with them through those issues. So I forgot to give everybody that. So talk about avoidance, arousal. Trauma can create a response of intense fear, helplessness, or horror. So the trajectory of the impact of trauma. So you have the traumatic event. And so we'll use the dog bite example, right? You have the traumatic event, you're bit by a dog. Actually, you know what? I'll tell you something personal, right? I was bit by a cat when I was 6 years old. I was bit by a cat. So, you know, cats just be roaming through the neighborhood sometimes. So I've always been an animal lover. It's always been my thing. I thought I was going to be a vet when I was a kid. But it actually just changed my life. It actually changed the whole trajectory of my life right there. This cat was in my yard. I'm petting the cat, and the cat turns around and bites me. Like, the cat didn't scratch me, it bit me. Scared the living mess out of me, right? So I run to my parents, and the response was, that cat didn't bite you. Cats don't bite. And so now I'm thinking to myself, like, wait, am I tripping? Maybe the cat didn't bite me. Maybe, you know, did he scratch me real fast and they just that fast or whatever? So that traumatic event happened. The aftermath, me coping with it, I was kind of struggling with, wait, I know I got bit by this cat. That's why my hand is bleeding. And, you know, I see little teeth marks in it. But nobody believed me. Nobody believed that the cat bit me. And then so the meaning attached to it, which is the worst thing. That's why I have that in the biggest box, right? So you have your event, the aftermath, how do you cope with it? And then the meaning that you attach to it is, you know what? I don't trust cats anymore. So I don't do cats. I do dogs, don't do cats. So if you think of different experiences that even you have experienced with some of your clients, right? You have that event that obviously is traumatizing, but kind of what is affecting them in the moment is the meaning that's attached to that event. I can't trust, you know, this isn't safe. I don't want to go to, you know, I don't want to be around men. I don't want to be around women because X, Y, Z, ABC may happen. And so being able to understand, that's why going back to the Bloom quote, why we have to change the way that we view the world. We have to understand that there's so many other things that happen from that traumatic event. And when you're talking about peeling back layers, that's what you're doing, right? You're learning, okay, well, this is what happened. All right, so how is that connected to today? You're slowly but surely working your way to connecting the two. So that's the trajectory of the impact of trauma. So why is trauma important? I would assume that most, if not all of you, have heard of the Adverse Child Experiences Survey. It was conducted in over a 2-year span from 95 to 97 by Phillip and the group that he was working with. It actually is one of the largest medical studies of abuse or neglect that's done. It had over 8,000 participants. I think it was well over 8,000 actually. But the ACEs survey it's a 10-question survey that explores 3 categories of experiences: abuse, neglect, and household dysfunction. And actually, it was initiated to study obesity, but what came out of it was, a study that uncovered so many other aspects and facets of life that are impacted by abuse and neglect. So if you haven't seen the TED Talk by Dr. Nadine Burke Harris, it is very impactful and very important for the work that we do. So I encourage you all to check that out. The TED Talk, so it's only like 15 minutes, but she breaks this down and really applies it to real life in a very effective way. And even today is one of the leading voices in advocating for ACEs to be incorporated in not only mental health treatment, but just health treatment overall. So the prevalence of ACEs, so from this study, at least they said almost 2/3, 64% of people have at least one type of ACE. They've experienced at least one type of trauma, abuse, neglect, so one of those things in the category of 10. And for those that experience 4 or more, they're saying it's like 1 in 6 have experienced 4 or more of those traumatic experiences. And so the impact, this information is coming from the CDC, Center for Disease Control. The impact of ACEs scores, they have lasting effects on health, obesity, behaviors, life potential, which we'll talk about that in a little bit. But I want you to look at this graph to the right of it, right? So if you look on the latitudinal line is the risk for negative health and well-being outcomes. And so as the number of ACEs increases, the likelihood of negative health and well-being outcomes increase drastically. And so the impact of the ACE scores continued. So those are some of the areas that we've noticed that individuals are impacted with high ACE scores. Chronic health conditions, mental health conditions, and substance use disorders, health risk behaviors, as well as social outcomes. One area, I can't remember if it was the CDC or not, but there was one area that I looked at. I was looking at ACEs, and it kind of outlined that for those that had a score of over 5, it was either 5 or more or 6 or more, their life expectancy decreased by 20 years. And so,
what is an ACE score? That's for us, I'm a dummy when it comes to stuff like that. What's an ACE?
No. So the average child experience survey. So it's a 10-question survey, and I'll show it to you shortly. It's a 10-question survey, just asks about your childhood experiences. And so for each yes that you have in these childhood experiences, is 1 point. And so for those that answered yes for 5 or more, they are more at risk. Well, as your number increases, you're more at risk for any of these health conditions: mental health, physical health, behavioral health, and some of those social outcomes. But for those that answer like 6 or more, their life expectancy decreased from like 80 to about 60.
Okay.
Yeah. And so, and really, what I'll do, all right, so let's do this. I'm gonna skip ahead for a second, right? And I'm gonna show you guys the ACE test, and you can look at it, you can go through and get your own score. I give you a minute to do that. We're not gonna share the scores, but it could just be for your own good, for those that have not had the experience. So this is the 10-question test, or survey rather. And so if you want to take a minute, just kind of go through and figure out your own score.
I've done this survey before. I remember there were 20 questions in the ACEs survey. There's only 10 in here.
So there's different variations of it that have come since this. This is the original one. And so there's another variation that came after that incorporated different different metrics and tools.
Is it possible to get a link to this PowerPoint?
Certainly, yes, sir. Yeah, I'll make sure we get that.
Thank you.
Mm-hmm. I see a couple of people still reading, so I'll give a couple more minutes for everybody to go through it. So as you see this and you read through these questions, think about some of the clients that you work with. And I know for me, in most of the settings, if not all of the settings I worked at, these are pretty much their day-to-day lives. You know, a lot of this is just things that they experienced because it was Tuesday, right? It wasn't any special thing, it wasn't a holiday, it wasn't anything, it was just this kind of what they had to deal with. And so as I learned more about ACEs and the impact that it has on individuals, you know, just understanding, it gives you a different perspective on, you know, kind of not only what their experiences are, but what they need to be on the lookout for, what we all need to be on the lookout for, right? Because we're health professionals, we're helping them. So the things we need to be on the lookout for and encourage them to do to kind of improve not only their physical health, but their mental health as well.
Someone asked whether or not the test is available for anyone to access online.
Yes, it is. If you Google ACEs, you'll find 100 different tests. It's not hard to find at all. So yeah, so you know, we talked about all the different ways that people are impacted by high ACE scores, including some of the leading causes of death. So higher ACE scores lead to toxic stress. What is toxic stress? We're about to find out.
The reality is that we all need a certain amount of stress, a certain amount of anxiety to perform well. If we don't care about that exam that we're gonna have tomorrow, we'll probably fail. If we're gonna cross the street and a truck is coming at us, we have release of adrenaline. We have release of a hormone that we call cortisol. We want to jump out of there, and adrenaline and cortisol are going to help us do that. So there's that good amount of stress. But if all day long you're feeling like a truck is coming at you, day after day after day, that's going to take a toll on the body. And the amygdala obviously here has greater activation in the PTSD. We were able to image children that had experienced trauma and compare those brain images with children that didn't have an experience of trauma and didn't have symptoms.
Right, an exaggerated fear response.
An exaggerated fear response with decreased activation in areas that we need to control that emotion in the frontal areas.
Exposure to early adversity and trauma literally affects the structure and function of children's developing brains. So the kid next to them hits them, or the teacher reprimands them in a way that they're uncomfortable with, right? Literally what they're feeling, that activation is like there was a truck coming at them. You can give something that will mask symptoms, right? For example, if someone has a cough, right? You can give them a really strong cough serum that will suppress their cough. But if it's because they have tuberculosis or lung cancer, then what you're doing is merely masking the symptoms while the disease process continues to fester. We know what's happening in children's brains and bodies with the experience of toxic stress. So the question now is, what do we do about it?
So That's the question, right? So we understand that.
The reality is that we all.
So we understand that, stress impacts the body, trauma impacts us throughout our lives. And so the question is, which Dr. Burke Harris ended with, is like, all right, what are we doing? Are we just treating symptoms or masking symptoms, or are we actually treating the core, right? And so, so what are your thoughts on that? What are some things that come up for you as you watch this video, as you hear some of these things, and you start to kind of conceptualize not only what we're talking about in regards to trauma and stress responses, but as it relates to what it is that you do? Yes, Dr. Dennis.
I think it's interesting because I like to tell my clients.
I think you went out. I don't know if you stopped talking or.
Thank you. And so it
Yep.
Can you hear me?
I can hear you now. You might have to
Oh,
go
okay.
back.
Sorry. I try to use metaphors and things like that. I think it's really good to help people understand the way that our body responds to stress. And I like to tell my clients that our body is literally responding as if a bear is in the room. And we use that metaphor so much that it gets to a point where they tell me, they're like, I was telling myself the bear are just my thoughts and I don't need to do this. And it's kind of funny and we laugh about it, but it helps them understand, why am I responding? Why do I feel this way? And it's just your nervous system overactivated. And so I love this video. I think that is really impactful.
Thank you. Thank you. Yes, and having those terms and being able to put these things in ways that our clients are able to digest them and utilize them on their own, right, and understand it is real important, right? So like I said, they're coming in there and talking to you about the bear. That's something that they understand, you understand, and it doesn't have that stigma that's attached to it either. Let me see, Ms. Corey.
Yeah, I also find it interesting with the analogy of the cough, because with trauma, a lot of times it's silent and it's up to us as clinicians to find ways to engage and to ask the right questions to help people to open up about it.
Yes, I like the way you put that. So trauma is silent. It's not, you can't just see it, right? Many of us have been through our own traumas that, we don't know, and, anybody else wouldn't know, we can't see it. And so we have to create that space, that safe space where the clients feel comfortable enough to share and open up about it so we can provide the support that they need. And so I love that, in this video, it talks about how, and it's a really good indicator of how there's, that response is continuous of what we experience. And everything seems like it's that same level of threat. Like say in the classroom, teacher tells you, hey, can you stop talking, or asks you to stop talking. But now because you've been called out, your body responds in the same way as it did in some traumatic experience that you've had in your past. And then we wonder why, what's wrong with him? What's wrong with her? Why are they responding like that? You don't know what happened to that individual. Anybody else?
You have a question in the chat from Deborah Vasic. Can traumatic events accumulate over time into adulthood to create trauma over the lifetime?
Oh, yes, undoubtedly. Yes. So traumatic events, so that's what you're essentially describing as complex trauma. And so, we overexposure sometimes. And so we'll go back to the social media thing, right? So we'll talk about that vicarious exposure can also be traumatic. Having witnessed, murders and, just horrible things over time can desensitize us. And that desensitization is essentially a trauma response, because like, all right, I'm overloaded. I can't deal with this anymore. So for like personally, when videos like that go around, I don't watch them, because I still want to be able to keep my senses intact when it comes to these traumatic things. And I still want to keep my humanity intact and be able to have empathy for people that are going through things and suffering. So I prefer not to watch those videos. But also same can be said about other traumatic events. They accumulate. And as we said in a couple of slides, right, the meaning that's attached to that event or those events create, just a larger trauma that one has to, not has to, but one experiences and deals with. Yes, is it Trankin or T Rankin?
T Rankin, Twala
T
Rankin.
Rankin. Okay. How you doing, Ms. Rankin?
I'm getting you.
Good.
You think that a lot of the violence and the chaos going on in the world has a lot to do with what's being shown on TV and the social media? And it seems, and I'm not trying to get into politics, but after Trump was elected, news is not the same anymore. Now you can turn on the news and you can hear inappropriate language. You can see people dying, as you said, in regards to George Floyd. You can turn on YouTube. It's always some kind of violence, and on a daily basis, you hear about somebody in a family that's killed all the children and then themselves.
Mm-hmm. Well, I think so I'm not sure if it really can be attributed to what's going on around us or what we see. But what I will say is that I think the desensitization makes it easier to do, right? If I constantly see something negative happening around me, then it's a whole lot easier for me to do it. So let's not take it to something extreme, right? If I'm driving on the interstate and everybody around me is going fast, what am I going to do?
You're going to go fast.
Speed up.
Yeah.
I'm going to speed up with everybody else, right? It's like, okay, well, I'm not thinking about the dangers that's associated with it. Likewise, when we talk about the trauma and the violence and all things that's so readily available in today's society, on social media and the internet, things of that nature, it has become, I think, less and more of a competition. It seems like in some cases, right? It's like, okay, well, this happened before, so I'm going to try to one up this in regards to violence and things of that nature. And it's very unfortunate, and there's a lack of humanity in a lot of it. And this is my perspective, this is my personal perspective. I feel like there's a lot of humanity is lost from that desensitization. And so, likewise, I'm not going to go into politics either, because Western Tidewater would never ask me to come back. But but what I will say is, there is, a sensationalized way that news is presented only feeds into it even more.
I find myself having to take a break from take a social media sometimes.
Yes, I encourage everyone to do that. Take some breaks from social media. Do that, please.
And someone made a comment that this would be vicarious trauma.
That's right. Yep, vicarious trauma. Exactly right. Ms. Wilson, I see your hand.
Hi, I was as I was doing the survey, the questionnaire, I find myself, even as a clinician, some denial. One of the questions on number 8 was, have you ever been hit or beat or whatever? So in my mind, I'm thinking like, well, I got spanked, but I don't look at that as traumatic. You know what I mean? So you're kind of resistant on even answering that question, because it's like, okay, I don't want to score too high, because then that means something's wrong, or something's gonna happen. And so I just in this moment, trying, answering those questions, I realized that, even as a person in this field, I still have issues with acceptance, I guess, in a sense. So it's just it's interesting. It's interesting.
Yeah, it's very interesting, and that is the thing that we constantly have to do when it comes to self-evaluation and understanding where we are and being honest with ourselves. We really can't be our best selves with our clients if we aren't able to be honest with ourselves as well, right? So exercises like the ACEs and various other things, it's important, because it's that self-discovery will help you become a better clinician yourself, right? And give yourself a better understanding of how you view the world around you. And like I said, some of those questions they're very, and I'm assuming, right, I haven't talked to Felidi or the group, but some of those questions being the way that they're worded, they leave the interpretation up to the receiver, right? Because like I said, have you, being spanked, right? It's like, all right, I was growing up being spanked. And it's like, all right, well, I didn't necessarily see that as, abuse, but was it? Like, all right, let me think. Well, you know what? That extension cord was a little, that you had to go that far, So, things like that, you really have to challenge you, make you think. And so what may be traumatic to you may not be traumatic to me and vice versa. And so, that's one thing that I do like about that as well. Yes, Mr. Jordan. Mr. Jordan, RW Jordan.
Sorry, there's too many buttons with mute on them.
No worries.
Can you hear me now?
Go off of what the last two participants participants talked about, and then what you just finished with, and that is the idea of the extension cord, and that to me would definitely be trauma. But I think, i.e., like in the last speaker when they said getting spanked, well, that's no different than a dog biting and somebody picking you up and say, it's okay, it's going to be all right, and easing that trauma. I think if you were being spanked and it wasn't in a fit of anger, it was in a fit of nothing. It was just a matter of consequence, and that being it. And I'm going to take that further. The other thing is when the speaker before that started talking and talked about,
wait, hold on, where's she at?
I think a lot of it, we can't just blame it on politics.
Are they behind the desk?
Our society in general, because think about it, you got families that aren't talking to each other over politics now. And so, I did 25 years in the Army, and one of the things that I know out of it, and my first degree is in behavioral science, I know that when we brought the boys home from World War I and World War II, there was no intention to even bring the dead bodies home, and they came home on troop carriers. Okay? Today, they come home on airplanes. So within 9 hours, they're back in a house with their loved ones. And where when you came home on a troop carrier, it would be months. Even Vietnam, they didn't bring you straight home. They brought you to Australia or Japan, and you had a 30-day wait there before they brought you back into the country. And what we're doing now with these kids that are coming home, they're coming home after 9 hours and going right back in the house after experiencing the online trauma. But I think what part of the problem is in our trauma today in our society is it's what you said earlier, how we deal with it. And one of the ways I was taught, you compartmentalize.
Yeah, especially I'm sure after 25 years in the Army, you got pretty good at compartmentalizing things as well.
We don't teach any. And so I think it's a society thing, and how we're treating each other and how we look at each other and how we value each other.
Yes. Yeah. You said several good things there, and like I said, that how we value each other, how we look at each other, how we show up for each other plays a big part in it. As well as I want to go back to something else that you said, right, about just kind of the spanking, right? Is it out of rage or is it out of correction? I think our ability to understand that makes the difference, but not our ability to understand that now in this big age that we're in now, but what meaning did we put to it in the moment, right? Because as a child, as a young person, if you're not able to see that, this is connected to, this my parents' desire to ensure that I did not do this in the future. You're right. So having that conversation, all right, and this is a thing that was big with my parents, right? I would get spankings. I'll go in my room and I'll be crying my eyes out, talking about how much I hated them, and then 20 minutes later, my dad would come in or my mom would come in, and they would have a conversation about it. Hey, look, this is what happened. This is why this happened. And so my meaning for that spanking changes, right? Because it's not about my own understanding as a child. They were able to connect the dots for me so that I didn't take it personally. I didn't take it as you hate me, you don't like me. So that's a huge thing. So something to remember for, for parents, for your clients, and all the above. I appreciate your insight, Mr. Jordan. And
You
thank
do
you for your
have one.
service.
You do have one comment from Amanda Hammond. I think about the systems that folks are exposed to and how they can play a role in re-traumatizing folks. I work in a rural community services board in court-ordered substance use and often wonder how we can make changes to reduce re-exposure.
So that's where you're talking about creating a network of trauma-informed care. And so, we talk about trauma-informed care versus trauma-informed practice. Trauma-informed care is the network that you're talking about, Ms. Hammond, that can sometimes be re-traumatizing for individuals. Some of the things is as simple as, the person comes to see me, I do my intake, and I assign them to Ms. Duncan. Ms. Duncan does her assessment, asks the same questions I just asked. And then Ms. Duncan says, okay, well, I got this information, so I'm going to help you from the therapy aspect. And then I'm going to transfer you to Ms. Wilson, who's going to do med management. They go to Ms. Wilson. Ms. Wilson asks the same questions all over again. And so this person is reliving these experiences every time they meet with somebody else. And at some point, he's like, you know what? Every time I meet with somebody, I end up feeling worse than I did when I walked in the door. When does the actual help start, right? And so creating a network that works together in a way that everyone can support that client and reduce that re-exposure, like you say, Ms. Hammond, I think is really important. Whereas trauma-informed practice is just the things that you do, right? So we can do trauma-informed practice ourselves, right? We can make sure that we are meeting the client where they are and creating the safe space that they need and hitting on all those 6 tenets that SAMHSA points out about trauma informed practices and make sure they're getting what they need with us. So the practice is the individual, the trauma informed care is the network. Any other questions? Anybody else want to add anything before we move forward?
If I can, I kind of want to push back a little bit in regards to that scenario with the parenting and the beating. If I could just add, one of the things that one of my favorite trauma experts is Dr. Gabor Mate, if you guys are familiar with him. And he talks about, trauma, basically that word, I think in the Greek means injury to the soul. So even if there was an explanation, and I'm not saying, obviously when we talk about trauma, not one size shoe fits everyone. It's based off of the experience of that individual person, family, whoever. But I want to be careful that sometimes even with an explanation, if it was an injury to the soul, and that could be your central nervous system, your brain, however you conceptualize trauma. If there is an injury that's left, it's still traumatic to them, irrespective to explanation and otherwise. So I just want to be careful about that.
Yes, very true, right? Like I said, everybody's experiences are their own. And so, even with that conversation, if that person has been traumatized, then, the damage has been done. So yes, good point. Anyone else before we move forward?
You did have one question, Cesar Esperat. How do you work with a client on learning to deal with the trauma without having to relive the trauma? I think you might have already answered that.
So there's several different ways you can do it, right? So in one-on-one work, I think what I found to be really helpful, so I'm trying to avoid things I've already said. So something I found to be really helpful in working with trauma is getting into somatic work. We get into, and we'll talk about this actually in the next couple of slides, right? It's like if you stay in the head, then you're really not getting to the core. You may be addressing those symptoms, those surface level things, but you're really not getting into the core. And so if we go with Ms. Robinson brought up about what Gabor Mate says, right? Trauma is an injury to the soul. Then if you stay up here, you're not going to get it. You're missing it. And so learning and becoming learned and understanding of different somatic level techniques, expressive arts, different trainings such as the EMDR, brain spotting, things of that nature, that can be really helpful with kind of addressing the trauma without re-traumatizing the individual. Anything else? Did I miss anything else, Ms. Duncan?
There was a comment from V Hall that there is an assessment entitled TFCBT that is designed to work with clients with trauma. It's evidence-based.
Yeah, so I don't know about this. So I know that the trauma focused CBT is really good. I know it's kind of geared toward young people, but some of the basic tenets of it I actually use with adults as well. And I think one of the main things that separates it from CBT is that trauma narrative and helping them with that. So yes, thank you for bringing that up. Good point. All right. So how does trauma affect the brain and body? So as we saw in the video, the fight or flight senses are activated by the sympathetic nervous system, and the stress hormones are released. So these are the three important stress hormones that are released, and I'm sure you probably already heard of them. Norepinephrine helps to shift blood flow away from areas where it might not be so crucial, like the skin, and toward more essential areas needed at the time, like muscles, so you can flee the threat. So like if you see some people when they get scared, their face may get pale. That's because the blood is going away from the skin and going somewhere that can help them to maintain their safety. Cortisol is in survival mode. The optimal amounts of cortisol can be life-saving, but chronic stress can create too much cortisol in the system, which can suppress the immune system, increase blood pressure and sugar, decrease libido, produce acne, contribute to obesity, and more. So understanding that all of these hormones are created and released by our body. They serve a purpose, and they aren't bad. But what this is saying is, in continuous, in amounts or continuously receiving this cortisol can lead to negative physical health effects, as well as impact our mental health. And then adrenaline, epinephrine, your muscles are tense, you're breathing faster, you may start sweating. Adrenaline also increases the heart rate to give you a surge of energy. So all of these things are happening within our bodies at different points in times, and we all have experienced it in one way or another. And so the goal is to ensure that it isn't something that's constantly with us. And so continuous exposure to trauma overwhelms our ability to cope with the things from a behavioral and a relational standpoint. And so if we were to put it in the picture, right, and kind of something I was just talking about, right? So trauma happens. And so this prefrontal cortex, this is where thinking, logic, what to do, all the evaluation, right? This is where this is happening. But as trauma happens, this part of the brain becomes weaker. And then it goes back to the hippocampus. That's what regulates the memory and emotions. And so that ties whatever the experience is to something around us. So it might be a song. The song can trigger a specific emotion or a response, our body's response. Could be a smell, could be a meal, could be a certain tree, could be anything. So that hippocampus is activated and it's tying that trigger to the emotion that we're feeling, to the trigger of that fight or flight. Then the amygdala turns on the fight or flight and stores memories of the event. And so this amygdala, this is the reptilian brain, this actually becomes stronger in the midst of trauma. And that's why I say, when we're trying to logic with a client who's going through trauma, who have experienced trauma, it doesn't work because this isn't working. Think about times where you've been in an argument with your significant other, right? And you're going back and forth, and your voices may be a little bit elevated. I'm sure nobody in here yells, right? Your voice may be a little elevated though. And they said, you didn't even hear what I said. I just said this, or I just addressed that. Or the other way around, you're not listening to me. Well, this is cut off. in the middle of that frustration, in the middle of that activation, they're going to fight or flight, because now I have to protect myself. Now I have to defend myself. And so I'm not feeling safe. So, the prefrontal cortex is out of the way. Amygdala says, hey, I got this. We're gonna stay. So I'll make sure we're safe. And our ability to logic, to reason, to think through things decreases. And so that's a big thing when, for those of you that work with couples, having that time out, say, hey, look, if you feel yourself getting elevated, if you see that the conversation is getting out of control, take a second, say, hey, look, let's take an hour to calm down, and let's come back and have this conversation. Because then that gives time for that prefrontal cortex to come back online. And this is why deep breathing is helpful, right? And so, that what it does is it helps us to reset us from that sympathetic to the parasympathetic, being back in control, and that prefrontal, we can now think in logic again. So that's how it impacts the brain. Other responses to trauma. So there are 4 responses of trauma and anxiety, right? So if you see this quadrant here, the bottom is totally disengaged, top is totally engaged. Left to right is to repel and to attract. And so our fight, the response is we attack, we confront, we dominate. The emotion that we're experiencing is anger, irritability. And the outcome, we may insult, may blame other people, may mistreat other people, right? So this is to repel that person through engagement. So I'm going to come at you to keep you away from me, or my emotions, or to ensure that you aren't able to hurt me. If you go down, you have the flight, right? So we're repelling by disengaging. I'm going to run, I'm going to hide, I'm going to quit. Denial, being anxious, that's some of the emotions that we experience. And then the outcome is that we evade, we omit, we sabotage. So we're trying not to, we don't want to engage with that person. And so we keep them away by increasing the distance, oftentimes physical distance, between us and them. You have your freeze. So we comply, we surrender. Those are some of the responses. The emotions, sometimes we shut down, maybe empty, some numbness. The outcome is justify, rationalize, detachment. You see this a lot in abusive relationships. And so that freeze response, and really a lot of times is if we're not careful, this is how victim shaming happens, right? It's like, okay, well, you know that this isn't good. Why didn't you stay? Why didn't you do anything? Why didn't you say stop? Why didn't you call for help? And their response is here. They're just shutting down. They're numbing themselves. If you've worked with people who've experienced different levels of trauma, especially sexual trauma, sometimes they'll say that it's like they detached from themselves, and that's how they cope. And so that freeze is attraction by disengagement, and then you have the healthy, quote unquote, healthy way of dealing with it is facing it, right? So the response is to challenge. The emotion is calm and grounded, and the outcome is being alert, being engaged, and being decisive about what it is that we're going to do in that moment. Any questions? All right, so let's take a break. We'll do about 15 and grab some water, and I'll come back and we'll get into some more fun stuff.
Thank you.
Down versus bottom up interventions, right? So the top down interventions, essentially, like I said, CBT and stuff, you're starting from the prefrontal cortex and working your way through. The bottom up interventions are more of the somatic ones that I kind of briefly discussed earlier. So things like, EMDR, really great one, especially working with trauma. Brain spotting, likewise. A lot of just IFS, things of that nature that are somatic in nature. Expressive arts are really good as well. Personally, I've been trained in EMDR. I've actually been trained in EMDR, brain spotting, and I've finished level 1 of IFS. And so those are really helpful. But sometimes you get clients that don't want to go through those processes. They may not want to go through those things, right? So some clients may be they come in skeptical. And so if I tell you I'm going to wave my finger in front of you for EMDR, if I tell you that, I want you to look at this pointer for brain spotting, or I want you to name your different parts, they're like, yeah, no, I'm not feeling that. I don't want to do that. So that's where, a lot of times expressive arts are good. Even just being in nature. So sometimes I'll, especially if it's nice out, me and clients will go walk and talk. And, that walk and talk therapy is really, really helpful for individuals as well. There's an activity, and the person who I got this from, her name escapes me at the moment. So I unfortunately can't give her credit, but she has a YouTube channel where she has all the different expressive arts activities. And one of the activities is you draw with your left hand. You have something, or your off hand. If you're right-handed, be left hand. If you're left-handed, be right hand, right? And so, you have, you just allow whatever happens to happen. Just let go of expectations, let go of shoulds, coulds, and ought to be's, and just allow that person to just go. And it's very frustrating for clients, especially the first time. It's very frustrating. But what I found is if we do it like a couple, 3 or 4 times, or I will do it in session, and I tell them to do it at home, they'll talk about how freeing it is. Because it, oftentimes if you're like, all right, I'm going to draw a tree, the tree has to be perfect. You're erasing and you're starting over and ripping the pages out, stuff, whatever. But if you're like, hey, look, just whatever comes out, just comes out. Whatever feels natural, just allow it to happen, especially if you're using watercolors, right? Because you have even less control over watercolors when it comes to blending and all that stuff, at least for me, because I suck at art. But it definitely is helpful in releasing some of that negative energy and bringing up, bubbling up to the surface some of the things that one is experiencing. So those are some things that I like to utilize with my clients.
You do have one question. What is brain spotting?
So brain spotting, and I'm not an expert in it, so I won't pretend to be, and so I will certainly encourage you to do further research. But the basic tenet of brain spotting is where you see affects how you feel, right? And so there's a point where in brain spotting, if you're looking at a certain point, it helps to unlock different subconscious thoughts and feelings. And so it's about helping the client find that point for them. And if you have them focus on that angle and look there, it helps to unlock their emotions and subconscious feelings and emotions. So certainly, that's a good, like I said, that is a helpful intervention as well. So any other questions? So essentially, that's kind of that was the basic kind of trauma, trauma training, trauma refresher, I'll say, for all of you. Thing to remember that, that chronic adversity, it impacts the way that we think, how we think about things. And it really changes our core schemas, right? How the beliefs that we have about ourselves, the beliefs that we have about others around us, as well as the world. All of those things change as a result of chronic trauma and adversity. And it also changes our expectations of the world around us, our interpretations and the meanings that we attribute to our interactions with others. So, with, everybody's favorite diagnosis, right? People that are diagnosed with borderline personality disorder, is, understanding that, is their expectations and interpretations of the world around them is usually a result of some type of traumatic experience that they've had. And looking at them from that trauma lens and from their trauma experience, rather than the symptoms and stuff that we're seeing on the surface level is important. So just remembering that is important. I left the ACEs survey. Hopefully everybody had a chance to look at it. I'll make sure that you all have a link, or like I said, I don't necessarily have to send a link. You can really just Google ACEs and it'll come up. It's free, so you won't have any problem finding that. All right. Anybody have any questions, any concerns, anything they want to add before we move forward? All right. So we're going to do breakouts for a second, for a few minutes, right? We're going to talk about what it is that you found most difficult when working with men, or what is the difficulty that you've had when working with men. So again, we're going to go into random groups, and I want you just to kind of process it with your group. This is an opportunity to learn, to grow. I want you to be transparent. This is a safe space, and just kind of let's just explore. What you found to be difficult, what some things that you struggled with, and we'll talk about it a little bit when we get back on the other side. And so, Ms. Duncan, if you could set that up, I would appreciate it.
I'm opening all the rooms right now. And how long did you want them to have?
10 minutes.
All right, 10 minutes. Please accept the invitation when it comes in.
I was the only one in my breakout.
Uh-oh. Everybody else went for pasta, huh?
Let's see if I can put you in one. For some reason, it kicked a bunch of people back. So we're just assigning you manually at this point. Oops. With 35 rooms, there's room for everybody.
More than enough.
Do not worry.
I didn't even know that was possible.
I've learned something new. I've never done one. There's this many people. Okay. How do I put you in a room? Let's see. It looks like everyone has one in it. Do you still have the invitation and could go back? They might not have accepted it when you went in there. Otherwise, I can put you in another one. Let's see.
So yeah, I do have it.
Okay.
Yeah.
I'm not sure if some people are not just in front of their computer, but
yeah, that's what I'm guessing.
They're not all accepting the invitation. So some people have big groups and some people don't.
Okay.
Yeah. Oh my gosh. I have to mute for a second. My sad little basset hound is in the other room howling away because no one's sitting. The saddest thing.
Poor fella.
Here's what's ridiculous. My husband's sitting with him because he's home sick today. He's not getting enough attention, so he's still howling. Like, this is
With the whole family. He wants family time.
he's such a big baby. I don't know if he has pets, but my Lord, sometimes it does make it difficult working from home.
Oh yes, yep. I got an English bulldog, and not much different.
So you know the need is real.
Oh yes, for sure. I think I lucked out because she doesn't bark much. She doesn't make much noise. She just snorts and snores.
That's funny. He doesn't bark a lot either, but he does howl, and he does, have a lot of needs. Yeah, there's an entire group of people who didn't join at all. Not sure what's going on.
Yeah, they probably took an extended break.
That's probably the group that she was in. That's why she's all by herself.
Mm-hmm.
I'm gonna pause this while we do this.
If we have any good news about today, we're not being hit directly by the hurricane.
Absolutely.
That
Absolutely.
is great news. Great news for sure.
Yeah.
All right. So welcome back, everyone. So in your breakout groups, you were talking about what it is that you find difficult, or what is a difficult experience that you've had when working with men. What are some of the responses or experiences that you heard from your group members?
So we said competitiveness. Men are typically competitive even when it's not necessarily appropriate or you're in the same group together. Responding and listening to female coworkers or professional, and verbalizing and expressing their emotions when something does bother them, doing it in a positive or constructive way.
Nice, nice. Can I ask for clarification? What do you mean by responding to their coworkers?
So like if you're in a meeting, the men may typically be the head or the boss of the meeting, even though it's not necessarily that's what their role is. So if women or, the group is talking and they're not necessarily listening to the ideas, or they already have a scenario in their head, just not being receptive to feedback or direction that people are putting, clients to.
Gotcha.
Not listening.
Thank you. Yeah, thank you.
Speaking for group 25, I think we just kind of revisited some of the things we discussed in the initial breakout around talking about trauma with males can be like pulling teeth. So oftentimes a lot of men will have a fear of being labeled as crazy or overly emotional. And then just speaking for myself, working with hypermasculine men can be triggering for my own trauma, and so that can make it difficult working with certain subsets of this gender population. And then also we spent a second talking about the intersection of like generation and age, and kind of men and kind of younger generations seem to be maybe a little more open to the idea of emotionally informed discussions.
Good stuff. It sounds like you guys had a good conversation, and that's a good topic of conversation, right? So just think about how different it is for for your experiences, how different your experiences are for men, let's say 40 and up versus men that are in their 20s, right? It's a very different experience about therapy, about getting help, about mental health overall, oftentimes. So
absolutely
good stuff. Who else?
So we talked about culture, I'm sorry, group 4. So culture could be a barrier. And then sexual dysfunction is, something that is hard to talk with about men if you're a female or male for that fact.
Yeah, I'll tell you, that is one of the most difficult conversations that I have with the men that I work with, because oftentimes there's that feeling that I'm less than, if I'm experiencing erectile dysfunction or something of that nature, any type of sexual dysfunction, then, I'm not as much of a man as the next person. And so that becomes a difficult conversation at times. So I can only imagine as a woman having that conversation, how that can be.
Right. And medications can also play a big part in that dysfunction as well.
Yeah. And stress, like understanding, and tying it to stress, because that too can lead to different types of dysfunctions. So good stuff.
So one thing I wanted to bring up is that I see often is that men who have experienced sexual abuse, molestation, that is a really hard thing, especially when they're newly engaging in therapy, for them to even begin to approach.
Yes, that is a great point, right? And really that fact alone is kind of what sparked my interest in getting additional training in trauma, right? Obviously in school you go through trauma training and stuff like that, but I wanted to get more in the know about how to work with trauma, how to help people go through their process, because so many men that I was working with were getting to a point where they were kind of sharing with me that they experienced, molestation at an early age, whether it be from male, female, or whatever, and knowing or feeling that it wasn't right, but not having the words to put to it. And one in particular is I'm thinking about one gentleman in particular. He was saying that he was celebrated because it was an older woman. It was his babysitter who was in her 20s. He was 12. And he told his friends, and they were all like, "Oh, it was kind of celebrating," but he felt that it wasn't right. He knew it wasn't right. Not just felt, he knew it wasn't right, but he couldn't put the words to what it was he was experiencing. And so and by the time I was meeting with him, he was in his 30s, and we just started working on that process. So, really good point.
We have a lot of comments in the chat. Katie Whelan wrote, men are more guarded, more defensive, harder to build rapport, harder for female clinicians with older males to build relationships where males view clinician as an established professional, regardless of age. Jacqueline Smith wrote in group 17, a big problem is men being receptive to a woman's intellect during interactions. And for group 27, men might be more guarded and sometimes state, you don't know how it is. You'll never understand how I'm feeling, especially if the facilitator is female or younger. Men who deal with conflict, does not agree with something, tend to try and assert their masculinity, becoming argumentative, not allowing the mental health professionals to speak. V. Hall wrote, this seems to be a consensus with men who were sexually assaulted as children. The shame that's experienced prevents most from opening up. Shame, embarrassment, guilt. And of course, the interaction with men may also be different depending on the setting and where they are.
Yes, definitely. Yes, no, that's a lot. Good stuff. Good stuff. And so one of the groups, I think it was 27, I think it was, they were talking about just kind of that resistance that you get, right? What do you guys do when you face resistance? How do you deal with that? How do you work through it? You just kick them out, like, all right, well, this ain't gonna work. I'll refer you to somebody else.
For me, I just let it unfold. I mean, the worst thing that you want to do is push back, because we're not trying to engage in a power struggle. So if they don't feel comfortable, then we can revisit it and talk about something different. It's just all a part of that rapport building stage. I think it should be more of just allowing that to unfold as opposed to trying to break into and uncover all the things that are traumatic.
Yeah. So
How about
not going that power struggle.
how about validating their feelings?
Mm-hmm. How do you do that?
So just recognizing and just, telling them that you understand that there may be some hesitancy and, them, engaging in certain conversations. And so just, encourage them and, to be patient and, try and, make them feel as comfortable as possible and work on the relationship.
Mm-hmm. Yeah. Focus on that relationship. Really, I think it's really good to a good opportunity, right? And that statement, because we hear it from kids, men, women, whatever, right? Sometimes you might do that statement of, you don't know how it is, you'll never understand. You know what? You're right. I will never fully understand. Why don't you explain it to me? Help me understand. What is it like to be you? What is it like to have your experiences, right? And so, and this is something that I'm kind of jumping the gun here, but there's something we're going to talk about later, is just kind of leading with curiosity, right? Anybody who's been through that trauma professional course, they talk about that a lot. Just leading with curiosity. Hey, well, help me understand. Because what that says to me, when I get the response, you don't know how it is, you'll never understand, what it is I'm feeling. That's telling me that they feel like I'm trying to move them in a direction. So let me step back. Let me remove me from the situation. Unknowingly, I may have said something or have done something that triggered that response. And so I want to check myself and allow them to lead, right? To lead to their experience, right? Because the client is the expert. Client is their own expert. We aren't the experts in their lives. We have a skill set and knowledge base that can help them uncover the things that they need to reach their goals, whatever their goals may be, right? And work through their traumas and emotional things that they're experiencing, but we aren't the experts. And I think a lot of times when I do supervision on people I do supervision with, I kind of reiterate that a lot. Don't go in there thinking you're the expert, because you will never, not you'll never, but it'll be difficult for you to make the progress with your client that is long lasting. So good stuff. Anything else in chat? The chat was blowing up for a second. Anything else good in there?
I've noticed with teenage boys in particular, you have to kind of strike a balance between being caring and also unbothered. Because like if I want it too much, they're not going to want it, but they need to know like that I care. So I try to, do a lot of self-determination, but also like, if you want to talk about basketball today, that's fine. Like this is your session.
Mm-hmm. Yeah. So allowing them to be expressive in whatever way that they choose is helpful. Because that what you're doing is showing that it is a safe space. This is we can connect. It's not just, you're not just another number. You're not just a person. You're not a paycheck. You're a person that I am concerned with and that I want to help. So, anybody else?
There's one comment that as females, it can be challenging to get through to male clients, as it can be difficult for them to navigate divulging their feelings or trauma to both family members and the clinician.
Yes. So feelings is and I know this is something that kind of been brought up a couple different times, right? It can be a difficult thing to explore when you're working with men, but it could be anybody, right? How many people have used the feelings wheel? I think that's a really helpful tool. And I might bring it up if anyone doesn't know what that is. But yeah, the feelings wheel is a really helpful tool because it takes those basic emotions, anger, happy, sad, whatever, and it gives more direct words. It breaks it down in a way that people are more comfortable with, and the men that I work with usually get a lot of benefit from using that. Yes, sir, Mr. Jordan.
Yeah, I've got it narrowed down to one button now. But here's the thing, and I mean this honestly as a question. If we believe if we believe that only someone who has experienced something can help somebody come through things, right? Then why do we cut off other things? In other words, if the best person to help somebody with drug rehab, if you go to any of the drug rehab centers, we've got individuals that have gone through the experience, blah, 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 blah. Why do we short sheet that on sex? Why do we short sheet that on, I mean, I'll give you a prime example. You come out of a combat zone and you're sitting down with a therapist that has never served, not even been in a combat zone, has never served. So if you're sitting there, and that's what I liked about your comment, is don't try to fix it. It's not about fix it. We can't fix anybody. They have to fix themselves. If you think you can fix somebody, I got news for you. Whatever they've done, they're going right back into again down the road. They're going to reoffend or whatever they're going to do. They have to fix themselves, and there has to be a want to fix themselves, or there has to be somebody that can teach them how to deal with that. But before you can teach them how to deal with it, before you can teach everything you've learned in college, you've got to sit down and listen to them and figure out what it is they need to fix themselves.
Yeah, I certainly agree with that, right? We do have to make sure that we are in the tail of the comet, as I've heard it put before, right? Just make sure that we are there. I will say, just kind of push back a little bit on what you said. I don't know that the only way to help somebody is to have somebody who's been through the same experience, right? So many of my clients, I haven't had their experiences, but I feel like I can still be helpful to them. It's not, so I don't know that it's about having had the same experience as much as it is about understanding that they are the expert and using the skills and knowledge that we have to help them unlock the healing that they have within.
No, I didn't mean it as exclusion, but what I meant is, how can we expect to fix somebody if we don't have the experience? That's why you have to learn from them as opposed to teach them.
Gotcha. Yep. Yeah. Okay. Yep. We're on the same page. Yeah, that's exactly what I was saying. Thank you, sir. Mr. Dukes.
Yes, sir. That's a very good point you guys just made. I appreciate that. Because there is a lot of pushback from people who might want help from something. They might push back from individuals who might not have had that same experience. But I've learned in my own personal life that everybody hasn't been through what I've been through. Everybody hasn't been abused or on drugs or things of that nature. But one thing that we all have in common is that we all been through pain. So we can identify with pain. That's why one of the most important tools that we have, in my estimation, is empathy. I might not have to sympathize with you, but I can empathize with you to try to put myself in your shoes to understand the pain that you're coming from, and listening. I think those are two of the most important tools that we have at our disposal: empathy and listening.
Certainly, yes, undoubtedly, right. And if you have got to the point where you don't have that empathy, it's really time to reevaluate some things, within the field. And I'll say, along those same lines, and I'll come to you next, Ms. Robinson. Along those same lines is, I can't even remember where I heard this from, but it was saying that throughout this human experience, there are three things that we all encounter at some point in time. One of them is pain, right? We're likely to lose people. We're likely to lose relationships. Things are going to happen that are going to cause us pain in our life. The other is uncertainty. There's going to be things we just don't know. In this life that we live, we don't know everything, and so that uncertainty is kind of sometimes what breeds that anxiety when it becomes overwhelming for our clients, right? So that's another thing. And then that last thing is work, right? We have to, in order to reach goals, in order to achieve things, in order to change things, there's a level of work that's required. And if we're able to understand that perspective and put the experiences that we have with that viewpoint, it makes it a lot easier for people to work through it and to get the energy that they need to take those steps, because it normalizes and helps them to really kind of put these things into perspective of, okay, you know what, this is I'm not on an island, and it's not just me, so I can work through it. If anybody else has done it, why can't I? That's kind of where I go by. Ms. Robinson.
Just want to add, I've always feel, I'm social work, so empowerment is a strong, using that empowerment, you don't have to go through what the other person went through, but you can empower them to utilize the skills and the tools that they've learned through you as the professional to be successful. And then secondly, to go back to the breakout question, what I have found is our own stigmas and biases have been in the way of helping our clients, particularly men, to be more effective in their process. Like we revisited before, society has trained, taught, acculturated, assimilated, whatever word you want to use, for men to not be their full selves, or we say now authentic selves. And I think our own biases, even as a female professional, our own biases can get in the way with working with men, and we got to assess ourselves.
That's a really good point, right? And I appreciate you sharing that. So that makes me think about, so in my capstone work that I did in regards to co-parenting, it talks about how so many agencies that work with parents, or that do the mediation for parents that are going through divorce, separation, and custody proceedings, operate from a deficit model, right? And so essentially that deficit model is the understanding, or the presumption that men can't be better nurturers, or can't be equal, not even better, can't be equal nurturers of their children as the mother. And so because of that, there's already this expectation that you're not going to be able to do this as well as her, so I'm not going to have these expectations of you. And so I'm not going to give you the same opportunities that as I would a mother. I'm not going to treat you in the same manner. I'm going to handle you with kid gloves, right? Which becomes, also almost offensive. It's like, okay, well, of course I changed my kid diaper. It's my kid. This is, you don't have to throw a tinker tape parade just because I did that. So, so understanding that, we do have some implicit biases, and being able to check those is important for us. And then that empowerment that you talked about, that's certainly important and needed, right? And those small things that we do, such as listening, that we talk about, listening to the client and allowing them to tell their own story. That's a level of empowerment, because it's showing them that they have a voice, and reinforcing that in them, and hopefully in other aspects of their life. Ms. Hutton.
Yes, I kind of want to piggyback on what Ms. Robinson shared, and that we have to be aware of countertransference. That is extremely important, not to try to fill the shoes of a mother or a sister or a wife even, to make sure that we're not looking at the men that we're serving as our son or our partner or our husband, and getting that confused, and being totally aware of that. And I think that's half the battle when you're working with men, and making sure you yourself are in check about those things.
Yes. And so, that somebody else brought that up earlier when we were talking about the group work. I don't see his face. I don't have his name, but I'm just talking about how, just those interactions, sometimes dealing with hypermasculinity, brought up, his own feelings and experiences that he's had in his life. And, like you're saying, Ms. Hutton, just making sure that, we don't try to fill that void, or, fit into this space that is not our own, outside of our, whatever our helping relationship is, our therapeutic relationship is. And, that's something that, is important for those that do supervision. Make sure that you talk about this with your supervisees. So many people, and I'm sure some of you can attest to this, and if you feel so inclined, jump in. So many people get into this field, great intentions, not good intentions, great intentions. We all want to help people. We want the world to be a better place. But a lot of times people get into it not having done their own work, and end up trying to do their work through their clients. Like, I know when I was in this point in time in my life, this is what I needed to hear, or this is what I wish somebody had said to me, or this is what I wish someone had done to me. And that's how, you can make a bad situation worse, right? That's how boundaries get crossed. That's how, you are not being attuned with your client, because they're maybe telling you these are the things that I need in one way, shape, or form. But you're saying, I already know what you need, because I've been here, and so you start to lead and lead them in the way that you feel is important, and not just standing pat and allowing them to be the curators of their own healing. So great point. Definitely got to make sure we are aware of that counter transference, and talk to, like I said, our supervisees and ourselves, right? We need to get, we should all have somebody that we talk to. I teach at Norfolk State as well. One thing I tell all the students is, you know what, if I ever become the head of anybody's social work department, I'm going to make it a requirement that everybody has to go through therapy. That, because not only to have that experience of what it is to go talk to a complete stranger about the innermost thoughts and feelings that you have, but also to help you to be the most effective aspect of yourself in these rooms that you're going to be in, and be able to leave yourself outside of the door, so that you can be present with that client and what their needs are. Ms. Hutton, did you have another question, or your hands are still up from before?
Do not have another question. I'm just kind of technologically challenged, and I can't put
No,
your hand down.
It's all good. So I like to see your hand anyway. It's all right. Mr. Jordan.
Yeah, I think there's a good example, and it was on the news last night, so we need to be. It was on a national news, look, on all the news stations, and they were beating him up for it. But I think that last night, this incident that happened in Maui, and now they're discovering where a lot of people didn't fulfill the role that they were supposed to fill. But the president, and I truly believe his meaning was true and honest, but he was trying to compare burning a minor kitchen fire in his house, to the destruction of an island. And it was just blown up on the news and backing up in his face. I think what he was trying to do is make an honest connection, but
right.
A small kitchen fire that the fire department had to put out, and the loss of his Corvette was not going over good in the social media thing, by trying to compare that to what those folks had lost in Maui. And so I think you got to be how you align your trauma to other people's trauma.
Well, and right, you do. That's something to certainly be careful of, right? And I would even go a step further, because somebody mentioned that competitiveness, right? So we don't need to compare traumas. We don't even have to do it. Your trauma is your trauma. Let's work through that. I may have had similar experiences, or I may not have had that experience at all. But let's focus on what your experiences are, and how that's impacting you. You get into very, very murky waters. Bringing your own self your own experiences into the rooms with our clients. Thank you for that. I didn't even see that on the news. So yeah. Anybody else? Experiences with supervisees, or just kind of conversations that you have around countertransference, how to deal with it? Anybody?
May I speak on that? I know for me, when I was getting my master's, it was a prerequisite for us to have therapy throughout the program, because, there are some things that just aren't identified to prevent a lot of the transference and counter-transference issues that may happen in the field. And so I have some supervisees in my private practice, and some of the questions that are often brought up is, well, this is how I feel the client is feeling, or this is, and things of that nature. And so being able to delineate from what the client is actually experiencing and presenting versus what the person is trying to work out through their sessions is ongoing for me. And I see that a lot. So I'm just very thankful that you brought that up.
Yes, no, really good point, right? Being able to separate that self from that experience is very important. And sometimes we aren't able to do it on our own. Sometimes we just got to spitball it with somebody else, whether it be in therapy or, as licensed clinicians, right? Sometimes we don't have time for consultations and to get supervision, or just to kind of process things with other people. But that's so helpful to be able to sit around with other people and discuss what you're going through, what you're experiencing with your clients, and how you're dealing with certain things. Just to hear yourself say it out loud kind of helps connect dots that otherwise won't happen. So thank you for that. All right, so let's move along. I'll hope no one is offended by language. If you are, I will allow you to excuse yourself for a couple minutes. I don't know if it's this video or another video, but we got a couple videos that has some minor language, nothing that is, you know, well, I don't know, I was a Marine, so I guess my take on language is not it's not very very good, I guess. But some minor language. Hopefully nobody is offended. If you are, I apologize in advance. And let's get this show on the road. So this one we're talking about men and mental health. And this is the show Hell of a Week with Charlamagne the God. I'm not sure if say, oh, I have to mute myself. Okay. Yes, this is the show Hell of a Week with Charlamagne the God. And I don't even know if this show's still on, but I saw this earlier this year, may have even been last year. And I kind of took this clip and used it in some of the trainings that I've done. So
this week, we got the tragic news that we lost Stephen Twitch Boss. Rest in peace to that brother. And I know this hit home for you, Jay, because you've openly talked about, you know, your attempts at suicide. Talk about the struggle that many black men face with mental health and, you know, why it's still not something we talk about enough.
I think it's still a stigma. We are doing better. We are making strides. But I think the unfortunate thing, man, is that so many brothers are struggling silently out of the fear of how will I be viewed if I tell the world or tell my circle, my family, my spouse, my partner that I'm struggling. And I think for me, it was difficult, I know when I was going through it after football, to talk about, I didn't feel as if I had purpose. And many times for most men, we identify ourselves by what we do. And we identify ourselves by our abilities. And when we can no longer do that and we feel useful. And I know after surviving 2 suicide attempts, I think what was important for me was to discover purpose. And that's not easy, right? We talk about find purpose, but it's not easy. And the unfortunate in all of this is that sometimes our silent pain takes a hold of our actual thoughts. And as I say, the worst place a man could be, man, is left alone with his thoughts. And I just think, you know, this has caused a real paradigm shift for us to really begin to consider how we interact with black men. We are so accustomed to seeing brothers be strong, but I think it's time for us to really humanize brothers, that we all feel that we're Superman. And as I believe, we have Superman moments, but the reality of it is that we're Clark Kents.
That's right.
Is that we live in a reality where we have failures, we have disappointment, there's shame, there's guilt. But I think it's important for us to begin to humanize black men because, you know, the human experience is tough right now.
What do you hear what do you feel when you hear that, Dr.?
I think some of it is, the one thing that we don't talk about is what the system does to brothers, right? Black men, other men of color, Afro-Latino men. When we think about things like mass incarceration, when we think about things like parents have to have the talk. I have a 16-year-old, my son is Miles, and having to have the talk with my son, worrying about, you know, when he leaves the house, hoping and praying he's gonna come back safe, right? That's a reality. And so many years ago, we did a study at the Acoma Project, and something that resonated with me that I feel like is applicable to what you shared is there was a sister who had just come out of homelessness or being unhoused. She was just reunited with her kids. And one of the things she said in the study was, I'm already black, I'm already a woman, I don't also need to be crazy. And I think what she was trying to hint at was the more marginalized identities you add on a person. I think about black men and all the, you know, venom that goes at black men all the time, and like all the ways in which brothers are torn down and not lifted up societally and, you know, in media and all those places. I think brothers struggle with this idea that if I'm also dealing with a mental illness, or if I'm also perceived as crazy, which we don't say in our house about people, we say it about situations, it's very detrimental to them, right? And it tears them down even more. So when I hear that, I always want to think about, what does the system do that fails brothers? There are things that brothers do, but there's stuff that the system does that hurts and harms our black men as well.
I wanted to say, Jay, like, you know, when you hear about these situations where people actually do complete suicide, how does that make you feel, being that you survived it twice?
Oh, transparently, I think sometimes there's a bit of survivor's guilt, and that's if I'm being transparent. But then there's appreciation for my survival because I went to therapy and then I began to go through this healing process, and I went back to school and became a therapist, and I began sharing with brothers and began sharing with the world because, as Dr. Alfie said, the system, and even when you study mental health, it wasn't for black people.
Right.
You know, mental health was for rich white men. And so from a system perspective, I feel that it's my purpose, and I feel that it is a God-given gift that he's given me on how to communicate that language. Because the reality of it, man, is brothers don't have the language. And people always tell me how you feel, but I don't know. You know, when I've seen brothers in practice, it's you have to give them the emotional chart to identify what their emotions are. And most of us, we only know how to identify with anger.
Yeah.
And the reality of it is anger is a very low-hanging fruit. And so it's hard for brothers to even say, what is joy? I was in my late 30s before I was able to say I knew what happiness was. Because most of us have had to bear the burden of our family, had to bear the burden of expectations. And we live in a world where there's a lot expected of us. And then if you feel that you can't perform, you feel like, well, what is my reason for here? And performing is exhausting.
When you say performing, what do you mean?
So when you think about femininity is based off of being. But we look at masculinity as doing.
Okay.
And so I think it's really time for us to really look at masculinity as both, right? Being and doing. And you think about it, right? Let's just say a brother's dating. You are now having to be conscious that I have to be able to financially not just provide, but I need to be able to feel financially secure in what I do. Do I really want to be open that I make $60,000? Because they said a high value man makes $100,000. So you think of that's performance. You think about
See, that's why y'all got to date broke men sometimes. Lord have mercy.
So you think about it from the perspective that the performance of, do I have the space to tell my spouse that I'm not doing well? Because if I tell them that I'm not doing well, are you still going to see me as a man? Will you weaponize the fact that I'm having a low moment, and then you take my low moment and almost emotionally break me down and says, well, are you really a man? Because real men don't cry.
Right. But don't forget the part that's on your shirt. When do we teach young men that they are enough just because of who they are?
That's right.
So part of our work at Mental Health Alliance and at the Acoma Project is starting with kids and saying you don't have to do, have, be anything, that your value is in your existence. And while it sounds a little corny and hokey, I think the more you can put that in kids' heads when they're little, both partners in the relationship, right? So I won't even gender the partners, but if one of the partners is a man and he's with a partner who's tearing him down because he doesn't make enough money, what's wrong with the partner, right? That's the partner has some warped thinking too, thinking that this man in this relationship is responsible for all the finances, for all of these things. And we were talking about backstage, a relationship should never be two halves that make a whole. A relationship is two wholes that come together, right? Two full beings. And so we've got to teach young people from a very early age, your value isn't just who you are. The miracles that it took for you to get here and all the people who didn't make it here, right? Like just born into this earth, we got to value life. And so we start with, I do that with my kids. Baby, you enough just because you're here. I don't need you to do anything. And if you do that, I think that can go a little bit of the way.
And that's a great message.
Let's give people some more solutions, man, because, you know, my therapist says that the cure for trauma is joy.
Ooh.
So how do we instill some joy in people this holiday season?
That's a good question.
I don't know if we can instill joy. I think you can discover joy.
Ooh, okay.
And I think you discover joy in some of the most simplest of places. And I think some of the most simplest things in life are the most profound. We're often looking for these big, you know, things and looking for things to be so massive. But I think sometimes joy is just in the space of people that you actually enjoy being around. You know, we talk about the holiday season, and we all know the song, it's the most wonderful time of the year. But it's not that for everyone.
That's right, especially when certain family members come over.
Exactly. So I think really identifying spaces and moments and even environments where just sitting here doing nothing is joy. You know, joy is not in doing. Sometimes joy is just in being in the presence of, I don't have to cook.
Harapan natin si Salvi, our host, and si Chinky, ang paboritong ninong ng bayan. Yes, pautang.
That was beautiful.
I apologize. I messed it up. I can't go back. But I guess you guys get the gist of what was going on there. What are your thoughts?
This week we got the tragic news that we lost Stephen Twitch Boss.
Yeah, that was really beautiful and true, and they did great.
Yes, a lot of good topics that aren't often discussed on the wide scale were brought up, and I think it's very important. Yes, ma'am, Ms. Hall.
Hey, thank you. One of my clinicians brought in this gentleman's book called Just Heal Grow, and it has really impacted a lot of the men inside of the jail that are reading it. So what he said was just absolutely prolific, and it speaks to the dynamics of how Black men deal with trauma and how it manifests itself. So this was really good.
Good, thank you. I'm glad you got something from it. I definitely did too. When I saw it, I was like, yeah, I have to incorporate this in a lot of the work that I do. Ms. Ruffin.
Hey y'all. I really appreciated the communication on the employment piece being identity. Like that has been oftentimes a barrier, even before we can deal with the trauma or the substance use issues, helping them to find themselves. And a lot of times we'll do a 16 personalities just because it's so fractured at the beginning of treatment. So I really appreciated that he shared that part.
Yes, and that's something that so many men, and I know a lot of times, I mean, for most of it, they were speaking about African American men, but really, I think that's something that across the board, a lot of men do experience. But it was certainly something I was glad to be touched on and addressed, because it becomes such a huge barrier in seeking help and receiving the help, because this is how we identify ourselves, right? You meet somebody, oftentimes for guys, you know, we meet each other, the first thing we ask, yeah, what do you do? Like, all right, so let me figure out where I can put you on my totem pole of importance, right? That stuff really doesn't even matter. Ms. Robinson.
So you're gonna have to excuse me because I see so many people that I went to school with, work with, interns. I just want to say, hey, everybody, I'm really excited. But
glad to facilitate this homecoming.
Okay, but besides that, I just want to highlight what everybody's saying. I just love it. I love the energy that everybody's giving. But that core central piece of men, whether you're Black, white, Hispanic, a mixture of all or nothing, all of the things, all that racial, ethnic piece, those pieces, it always boils back to what are you doing, And I think, as stated before, giving them that sense of you are valuable because you are alive, you have breath. I can remember I was working with somebody in their late 20s, African-American male who was, he had CPTSD, which is not in the DSM-TR, but TSM-5-TR, but, we know that it exists. And one of the things that he kept saying is, I don't understand, why was I not enough? Why did I have to be discarded? And so, yes, giving voice to, yes, you were enough because you exist. So thank you.
Yes, no, and that's something that we don't hear enough, right? Like, so you are enough. That sweatshirt, I love that. Yes, sir, Mr. Dukes.
Hello, everybody. Look, that video was so incredible. And two things I want to expound on. One is the Clark Kent Superman aspect, because we all are trying to be Superman, but most of the time we are Clark Kent, and that just blew me away. I really like that part. But the other piece is that, it's so important for young kids to be sharing, or share with anyone, or for people to be told that they're worthy and stuff like that. But there's a saying that it's very hard to give away what you don't have. And that's why it's so important, man, for those, once we get to a place of healing, whether we're helping others, or we're receiving help, once we get on the path of healing, that we allow ourselves to be open and vulnerable to sharing, so we can continue to heal and help other people along the way. So I just wanted to share that.
That's right. That's right. Yeah, I think one of the things that I pick up from, different podcast stuff that I listen to is like, what fun is having the world if you don't have your people around you, the people that you care about can't share it with you, right? So we get to this healing, with this, let's share it. Let's give it to everybody around us so we can heal our communities, heal everyone around us, so that we can all progress and be better. Yes, sir, Mr. Jordan.
Yeah, I'm right there with Mr. Duke. But here's the thing: if we're going to make a difference, take a look at our society. We have a lot of people that become successful, and then instead of saying, "I did it, you can do it," and exactly what Mr. Duke is saying, improving people by saying, "Hey, I did it, you can do it." We've got a lot of successful people on the top that are busy talking about being victims, as opposed to saying, "You can do it." With all the trials and tribulations out there, if I can do it, because I went to flight school, and one of the things I was told was it's a 98% washout rate. Okay. And I was told by this one guy, he said, "Let me tell you something, you're going to want to quit at times. But the bottom line is, if I can make it through, you can make it through. And there's hundreds of other guys that made it through." And that made all the difference in the world to me.
Yeah.
So, yeah, we've got too many people in our society that are busy talking about, "Yeah, you're a victim, don't worry about it," as opposed to, "Yes, you can,"
And that's what we need. We need that in our corner, right? We need the ability to have that person that we trust, that we know has our best interest at heart, to say, "You know what, you can do it. You have the ability, you have some tools. You don't have to hit a home run every time. Just get on base. You don't have to be Superman. Be Clark Kent. That's good enough. Much needed." Dr. Harlow.
Hey there. So I really love this piece because I really think that, like, with the current state of our youth, right, and the need that they have for people to co-sign what they do and to help them create their success is just crazy. I have a 23-year-old son who graduated from an elite college, and straight from graduating with his bachelor's, I mean, he went into the entertainment industry. He was touring with the artist Her and with Coldplay, making $75,000 a year. Now, I look at this and I say, wow, what a great job. Fresh out of college, this is excellent. All it took was one person to say, I think you could be doing more. I think that's not good enough. Of course, it was a woman, but that's neither here or there, right? For him to feel like, wow, well, maybe this is not good. Maybe I'm not doing enough. Maybe I should be doing more. And he was second guessing now if he was enough, right? But thank goodness that from the very beginning, I really instilled in him that you are enough because you are, period. You don't need anybody to co-sign that, but he lost it in that moment, right? So I had to really revert back to that and remind him that because he is enough. It really doesn't have anything to do with what you're doing or what that title is right now in the moment, but because you are enough, And I think that so many men, because in society we expect, right? We expect that the men are going to show up, right, with substance, right? At least in my immediate circle, right? We expect that they're going to show up with substance. And so when they fall short or they're not as successful as you believe that they should be, automatically you count them out, right? And so it's so important for us to really just encouragement, to understand that, you're showing up and your presence is enough just the way it is.
Yeah, thank you so much for that, Dr. Harlow. I as you're talking, I'm thinking about some of the things you're saying and kind of applying it to some of the people that I see, especially young people, not even necessarily kids, but young adults, right? They are coming into their adulthood in a deficit, as far as the self-worth and self-esteem, right? And I say that because social media is such a big part of everyone's life at this point in time. It is what it is. Social media is a huge part of everybody's life, right? And what do we see on social media? We see the highlight reel. We see all of the best of everything. We don't see the hard work and the grind and everything that it took to get there. We just see the big houses. We see nice cars. We see nice clothes. We see all of these things, right? And so these young people feel like this is where I'm supposed to be. And, that puts them at a deficit before anything is stopped, before they even start their process. So that's why parents like yourself are so important to instill that from a young age. Hey, look, you are enough. You doing the best that you can is good enough. And without that, the clients, our clients, our clients, our kids, are really in bad shape without that. Thank
That's
you.
good. And I think that even, with our children, yes, we have to, steer that in them. But I think that even with our clients, right, helping them frame some of the things that they've been through and helping them understand that, look, everything that you've been through it's not you, right? These are experiences that happen. These are things that took place, but it doesn't represent who you are. It's a part of your experience, but it's not you. Right. So I think even in that, it's important for us to do that even as clinicians.
Yes. Good stuff. Good stuff. I'll tell you when in watching this video, and then I don't know why I just stopped. I wish we could have caught the rest of it. But some of the things that kind of really stood out to me, first and foremost, just talking about, and it kind of changed the way I looked at or approached my work with men. Just kind of talking about how there's already so much stigma attached to being, especially we talk about men of color, right? So there's already stigmas attached to being a Black male, what you are, what you aren't, what you are and aren't able to do. And so to add to that you have a mental health diagnosis can be the straw that broke the camel's back, right? Just be overwhelming. And so understanding that, that stigma is there and not just adding additional marginalized tags to our clients and the people that we work with is super important. And there's something else that kind of stood out to me, right? So when Charlamagne asked the gentleman, I think Jay Barnett, I think is his name. When Charlamagne asked him, how does he feel when he hears about other people who have completed suicide? Did you guys see the look on his face? That was such a visceral reaction. And I'm sure it's a TV show, right? So I'm sure that they get questions in advance. But that reaction that he had was so natural. And like you said, I'm gonna be transparent, right? And kind of just talking about that, you could see the emotion behind his eyes and in his affect in hearing that and being asked that question. So that really stood out to me. And then we talked about having to perform, right? Being versus doing. So one of the things I was going to do, I was going to ask everybody to I was going to do a word cloud, right? I was going to say, hey, look, everybody, give me a word. The first word that comes to mind when you think of a characteristics of a man. So I want everybody just to think about it. Just think about it real quick, right? Think of the first word that you think of when it comes to the characteristics of a man.
Strong.
Strong.
Protector.
Protector rather. Provider, gatekeeper, resilient.
Confident.
Loving. Confident. So work, leader. I'm looking in the chat too. Provider. So you have all these words, right? And so and that is, excuse me, that is kind of what Jay was talking about when he was saying that it's about being a performer. You have to perform. And being a man essentially means that you always have to be on, because you have to do all of these things that that we're talking about. And I'm no exception. I'm not saying this to put anybody down. I'm no exception of the words that y'all use are actually spot on, right? But being a provider, being a visionary, being guarded, being a leader, all of these things are actionable things that we have to do. Can you guys hear me? Can you hear me?
Yes.
Okay.
Yeah.
All right. So yeah, so being able to do that, all of those things come into being a man, and so it becomes pressure. It becomes, almost a burden at times, because it's like I have to always be on. That's what Jay was talking about. I always have to be on. I always have to perform, and I can't just be. I always have to be doing. And so that's one of the things, as you're working with men, be mindful of that, right? And call them out on it. Hey, look, you're doing a lot. You got 7 degrees, and you work 5 jobs, and all this stuff. What does it mean to be you? And so just something that stood out to me in that video. So I'm glad it sounds like people got a lot from it. Yes, sir, Mr. Jordan.
Yeah, I just want to put something out there for people to think about. There's an old saying that the woman is the hand that rocks the cradle of the world. And no truer words, but I think what everybody forgets about, it's the man that provides the validation. You look at a woman, she will fall in love. Her first real love she falls in love with will be the first love of her life, which should and more likely is her father, if that man is a role model for her. And then if you look at a man in a family with a young man, it validates to a young man the validation of becoming a man is the father.
Yeah. That's really that's important. That's definitely thought provoking. Something to think about. And along those same lines, something that I hate to see is the divisiveness between men and women. Right? I hate to see that, because the reality is we all need each other. At the end of the day, men need women, women need men, or we need our other halves in order to be the best version of ourselves. And so that's something that I really hate to see. Yes, ma'am, Ms. Robinson.
I did want to point out, and I'm going to stop. One of the things too, I feel like sometimes we miss the Caucasian or European American or white American. There's so many different ways to say that. Male experience as well, because of, the stigma that's associated to that, the concepts that we have developed, what has happened in society, etc. But I do feel like those voices needs to be heard as well, because there is a level of marginalization that happens in that area as well. So I know we're obviously talking about all men, and we kind of highlighted, men of color, but I also want to speak to that part of it as well.
Yeah.
Well,
so right. So you're right. So there is, and really we can say that about every gender, every race, creed, religion. There are aspects that should be kept in mind throughout our therapeutic process, and just understanding that there are stigmas and different experiences that are less than optimal, for so many different types for so many different people. When we're talking about mental health in men, you're right, across the board, so many things that ones have to kind of work through and on to become their best self. So, all right. So barriers to men processing their trauma. There's no typical response to trauma, right? Any response is normal to an abnormal event. The struggle with having to uphold societal expectations of what a man is, right? So everybody just gave their first word that came to mind when it comes to characteristics of a man. So sometimes, you may not feel like you can do that, or like in the video, right? When Jay was saying that, I may not have it. I'm making whatever I'm making every year. I'm low on funds. Just feeling like, okay, if I talk about this, how is this going to come back? And can those expectations, or do we expect the expectations or the characteristics that we define men as? Do we expect that to be all the time? Do we expect them to be leaders all the time? Do we expect them to be strong all the time, providers all the time? Or are we allowing them to have low moments, to be human, really, right? Because you can't, so we always can't be nobody can be Superman all the time. Sometimes you're going to get Clark Kent. And what happens is sometimes you feel weak or like a burden if they're not able to meet those expectations. emotions in general for men is a taboo subject. You know, so often we're told, you know, just man up. You know, you're a kid, you're crying, hey, man up, you be all right, dust it off, men don't cry. You know, you're all right. And so it becomes that's how we're brought up, and we're generally agree or believe that after a while. Next, men are often linear, solution-centered thinkers. Can y'all hear me? I think my headphone just went dead. Can you guys hear me? Okay. You know, often linear, solution-centered thinkers, right? And so with that, you know, the thought that, you know, I can fix that, you know, there's no need to talk about it, right? If I'm sorry, if I can't fix that, there's no need to talk about it is often prevalent, right? Because it's like, all right, there's no solution to it. Ain't no need for me to worry about it. And so they will often avoid certain topics of conversation. The fear that any information shared will be weaponized in some way. So whether it be in a relationship, whereas, you know, if I have this conversation, or if I tell you these things that I'm going through, or if I cry in front of you, I have these feelings that later on you're going to use it against me. Or a lot of times you see it in military, right? I work with you know, military servicemen and women, and one of the first things they ask is this information going back to my command? You know, what you know, what is it that you have to tell you? Especially if they're ordered to come to go see therapy, they will be slow to open up oftentimes, because they want to know what information is going to be shared and want to make sure that nothing that is pertinent to them is going to be shared with their command or anyone else for that matter. So oftentimes what happens is when you have someone in your office and they don't open up as soon as we would like them to, or if, you know, they don't seem like they're engaging in the sessions the way that we think that they should, we'll label them as non-compliant. And non-compliant is one of the words that I hate in this field. Like we all use it. We use it so often. Like I said, from my very first job in social services up to now, right? It's you know, oh, so-and-so is non-compliant, you know, but the reality is it them being non-compliant, or do we just have to find another way to engage? I think, you know, because they've disengaged for some reason. Something's happened that caused them to disengage, whether it be between the two of us or some other experiences that they had. They found that they needed to disengage. So let's try to find another way. So as opposed to being non-compliant, let's say the client is disengaged. And so that puts the onus on us to try to find a way to engage, to re-engage that client so that they can get the benefits that that they need from treatment. And so what does disengagement look like? So a closed communication style, right? So maybe nonchalant about everything. You might get poor eye contact, you know, irritability, you know, that, you know, can come out as, you know, some aggression sometimes, maybe some being argumentative. I think somebody mentioned earlier, you know, being cut off constantly, you know, so the communication style cannot be open sometimes. Another thing that disengagement was like, a lack of participation, poor attendance, minimal engagement. And so what I saw in that research, when I talked briefly earlier, when I was saying about the deficit model, what they found was that lack of participation was geared, or was labeled as non-compliance, but reality is that the men felt stigmatized, and they didn't have any connection to the program, to the people that they were working with. And so it was easier for them to just, you know, I'm going to separate myself. I said, going back to earlier, I'm saying, you know, solution-focused thinking, you know, all right, so I can't control anybody else around me. I can't control how this program is going. It's easier for me to just disengage and not show up than it is for me to continue to fight a battle and try to change other people. One thing I found that was prevalent in my co-parenting research was that in any of the studies that I looked at, it was over 20 that I used for my capstone, but many others I looked at, none of them was able to attribute the father's lack of engagement
to their lack of desire to be a father. There was always some type of extraneous situations or circumstances or other things they were dealing with that the disengagement was the easiest way for them to deal with it, as opposed to going straight to it, right? And we see it, right? So more often than not, the people that are coming to our offices are women, or they're not men, right? And so, you know, they will make the decision to deal with things on their own, and not seek the help or seek the change that could be helpful to them. Another thing disengagement looks like: anxiety from being overwhelmed. So looking at anxiety versus panic attacks. So anxiety, there's a known trigger. Panic attack, not so much, right? And so understanding that, you know, sometimes being overwhelmed will cause anxiety and the anxiety and or panic attacks. And then lastly, sadness or depression. So what does that often look like for men? Isolation from others, chronic fatigue, poor sleeping and eating habits, anhedonia, right? Just not having or not finding enjoyment in things that they once did. So impactful interventions. We'll watch this quick video and then we will talk about some of those interventions.
You were hurt by someone you trusted.
Yeah.
Like the family member who abused you.
Yeah.
Which made you feel powerless again. Is this cool? You should release this.
Wow, when I saw that scene from Atlanta, I knew I had to talk about it on this week's Cross Connection because it's really not something we see on TV every day, and that's Black men in therapy. And of course, you may remember Kendrick Lamar's album, which dropped this summer, that also explores this very timely topic. Now, according to researchers, Black men are about half as likely to pursue counseling as their white counterparts when experiencing anxiety or depression. Well, the first step in breaking that stigma is to talk about it. And so here with me is Dr. Michael A. Lindsay. He's Dean of the NYU Silver School of Social Work. And back with us is Dr. Jason Johnson. Mike, I want to start with you. Dr. Mike, my Morehouse man on set with me. Great to have you here with me on set, seriously. And I just, you know, I've noticed that this conversation around therapy and Black men is becoming normalized, but maybe not normalized to the extent which it needs to be. Why do you think that's happening now?
Well, I think the pandemic has certainly had an impact on how people are being in touch with their emotions and their psychology, if you will. People are being encouraged to talk about how the pandemic has impacted them. And I think it's a great thing because for so long, there's been so much stigma related to talking about these issues. And so, you know, the time is really perfect for us to be having these conversations because so many people are hurting as a result of what has transpired in the pandemic.
Yeah, it's nice to see. Jason, I'm putting you on the spot a little bit, getting in your all up in your biz. But seriously, have you gone to therapy before?
I have, and I actually really debated as to whether I was going to answer this question because it's not so much a fear of threatened masculinity. I just never wanted to really talk about it. But yes, I actually had a therapist. I was uncomfortable, frankly, and I felt like the world doesn't need to know. But you realize that having conversations with the other brothers in my life about their therapy journeys have been helpful. I was in therapy when I was in school because I thought, oh, maybe I'm just stressed. Graduate school when I was getting my doctorate. Because I thought, oh, maybe I'm just stressed. But it's like, oh, no, this is anxiety. I'm not sleeping. I'm not eating well. And it was a critical part of me moving forward. And I had the rare experience, and I'd love to hear what Dr. Lindsay thinks about this. I actually had a very good experience with a white therapist. Since then, I've never interacted with a white therapist, but I had a white male therapist who the first thing he said to me is, are you comfortable with talking to a white guy about this? Because I understand if you're not. So that's what built a really good relationship.
That makes a really good point, though, because there does seem to be a necessity for cultural competency when talking to. So when we talk about Black men in therapy, there's also a delta when it comes to Black men therapists.
That's right.
So how can that be addressed?
So what we know is that only about 4% of the mental health workforce are actually Black.
Wow.
And so as a dean of a school of social work, the Silver School of Social Work, it's really important for me to bridge that divide by bringing more people of color, people from historically marginalized populations into the profession, showing them that, you know, you can do well if you come into the behavioral health workforce. And so, you know, to Jason's point, I think that so many people struggle with, I want to see a Black therapist, I want to see someone that looks like me. And I often tell folks, the most important thing is to see someone, right? And then work it out. Just like we have to go to various beauticians or barbers until we find the right fit. You know, sometimes we have to go through that process until we get the right one. But to go to someone is really, really critical.
So I think there's some good stuff that was brought up there, right? In that short clip, right? Just talking about how, first and foremost, just looking at that clip from the show, right? Atlanta. You know, when as the therapist was hurt by someone, as the therapist was helping the gentleman work through his experiences and his trauma, you know, having a breakdown. And what I liked that he did was he shortened the distance between them, right? Let them know, you know, by proxemics that, you know what, you're supported. You know, I'm going to support you. Go ahead, let it out, and I'm here for support, right? He didn't go overboard, didn't hug him, didn't cross any boundaries, didn't do anything. He just got closer to him and let him know that, you know, you have that support. So I think that's a very important thing that we can do. Obviously, when appropriate, right? And I would assume that they had a level of support. And this is a TV show, right? So it's a TV show. So for what it's worth, it's a TV show. But, you know, in actuality, you know, if you have that relationship and that rapport with the client, I think that is a good intervention to use. Is like, so you don't have to say anything, just being close. So in the video from there, they were talking about how, you know, supporting just to go see somebody, right? So regardless of what race you are, that's irrelevant, right? Because right now there's people in need. And myself, as an African-American male, I am full. I can't take any more clients. And I get calls daily, almost daily, almost daily. And I hate to turn people away, as I'm sure most of you do, right? We'll be in this field. You know, we came to help everybody. We want to save the world. But I have to understand and realize that, you know what, even I have a limit, right? And I won't be able to be my best self if I keep adding on more clients. But regardless of what we look like or what the client looks like, we have to be able to be open. But what I like that the gentleman said about the client that he went to go see is he asked him, hey, are you going to be comfortable talking to a white male about this? You know, and you know what that does by addressing that elephant in the room, it opens up that conversation for, you know what, I thought this, that, and the third, or I was thinking that this, that, and the third would happen, but, you know, I don't see that. You know, I don't see that as being the case. Or we can start that process of building that rapport and that trust, and trusting that, you know what, I'm just not going to let things go and act like there isn't anything that could be a barrier to you open up. Let's address those barriers and go from there. So some other impactful interventions that are important, leading with curiosity, we already talked about, right? Understand that the client is the expert on their life, and allowing them the opportunity to share at their disposal, and just asking the questions to hold space for them. Next, give a plan of what is to be expected and how your interventions will help. So giving that information up front helps the client to kind of grasp what it is they're going through, decreases anxiety, helps to deal with any stigma, and it leads to more helpful and productive conversations. Because, you know, and I tell my clients, you know, we're going to go, I use the triphasic model. So I explain that to them, and we go through kind of what that looks like. And, you know, they can go back to that at any point in time if they need. And also I tell my clients, I say, look, if I ever ask you to do anything and you don't agree with it, or you don't know why I'm asking you to do that, ask the question, ask why, right? Because I'm not just making stuff up, you know, on the fly. These are things that I researched or I found in some way, shape, form to be helpful to people that are in your situation, that may be in your situation, and I want you to get that same benefit from it. So, you know, allowing that open dialogue is important. Staying in the moment, using the client's language. And so, you know, for someone who's already on the fence about whether or not mental health care is going to be helpful, if it's for me, or if I can look past the stigma, if everything I say is reworded to words that I don't even understand, or some jargon that is beyond me, how you think that will make me feel? Only more inadequate throughout this process. And so make sure that we're able to use the client's language to speak to them and be present with them in throughout that process. Help them find solutions. It will also help them to build trust. So they say depression is often based on feelings of helplessness, powerlessness, and the inability to impact their environment. So for us, let's tackle that low-hanging fruit. You're feeling powerless on certain things. What are the things that you do have power over? You're feeling helpless. What are some areas that you can impact to change? They inability to impact their environment. Let's figure out how we can do that. Start with the low-hanging fruit, just to get that momentum going, right? Just like, if you do, I'm sure everybody does CBT, right? And talk about how that high rate of return is for people that do homework after that first session, and so just giving them something that they can do that make them feel like, all right, you know what, I am making progress. This isn't, as painful as I thought it would be, or as harmful as I thought it would be. And so, let me give it a try is important. And then honoring the client's process by holding space for them, be attentive to their words, but also pay attention to their body language, because what they don't say is just as important as what they do say. Be encouraging, like we were talking about earlier, right? Let them know, you are enough. You have what it takes. Somebody's done it, so why can't you do it too? Somebody's worked through it, been through it, so you can too. And don't try to force the client down a path that you feel more comfortable with. And so, going back to that feeling that, we can heal the client, we can help the client, right? And if a client is angry, allow them to be angry. Anger is an emotion. And they are entitled to that. That's okay. We don't want to dehumanize emotions. In that earlier video, Dr. Alfie was saying just that, right? It's like, all right, well, we didn't get to that part. At the end, she talks about that stigma of being an angry Black woman, right? It's like, all right, I am a woman. I am angry sometimes, and I am African American, right? So I can be all three of these things, and that's okay. But we stigmatize these things. And so honoring our clients and allowing them to be where they are, and let's just be present with them, right? The old cliche saying, right? Meet your clients where they are. Let's actually do that, and allow them to be where they are in their process. And then balance. What does balance look like? Has anybody ever heard of Ikigai? So it's I found it. I was doing some research for a client of mine that I was working with, and so I came across this concept, and it is from it's a Japanese concept, which means Ikigai means reason for being. And so it helps one to find their purpose, right? So we'll go through it. And so going back to what we were saying earlier, right? We want to help our clients to find purpose, or our men find purpose outside of a job, right? Outside of what you do for a living, or outside of how much money you make. Who are you to the core, right? So it's based on 4 different concepts. That first one is, what do you love? So the thing that you love causes you to be present. It makes you feel good and focus in that moment. It allows you that opportunity to be who you are, be where you are, and just be fully present. Next is what the world needs. This is a second concept, what the world needs. And so what the world needs makes you feel good when you know that we're needed by the community, by our communities, by our world, right? The things that we do are impactful. That makes us feel good to know that. And nowadays, with the way that things are, it's kind of hard to see positive effects on a lot of things, right? Because there's a lot of office jobs and a lot of things that aren't directly related to personal well-being. Like, you think like back in the days, right, where you had people that were working at the Ford plant. They see Fords go by, there was pride in that. People that were farmers, right? They know they're helping to feed the community, and all these different jobs that were there before that allowed them to see how they were impacting the world. Sometimes it's difficult to see that now. with the way that things have changed so much. The third aspect of the Ikigai is what you can be paid for. So not saying that money is the source of happiness, but without money, it's kind of hard. There's a lot of stress if you don't have money, right? You got to find a place to stay, you got to eat, you got to do all these things in life, right? So if you don't have money, it's going to be hard for you to be happy. So you have to find something that you can be paid for to live comfortably. Not that you're going to be, in a mansion on, Santa Monica Pier, but just something that wherever you are, you can live comfortably. And then the last concept is, what are you good at? So it doesn't necessarily even have to be something that you're naturally good at. It can be something that you can put, that you're willing and able to put time and effort in to improve and break down barriers and just overcome those obstacles so that you can see that process of becoming better. So those are the 4 aspects of the Ikigai, right? So you have your clients write all these things down. What do you love? What does the world need? What can you be paid for? What are you good at? And then what you'll see is in this Venn diagram, where you have these overlaps, you have different things, right? So you have your passion, right? When there's love and when it's something that you love and you're good at, that's your passion, which is great, right? Because that's, if you're passionate about something, that means that you're enjoying it and it's something that's moving you in a positive way. But the difficulty comes in when, you have to figure out how to make money with it. Right. So if I love, making, crocheting blankets, that's cool. I have a great time when I'm doing it. It may be a great way to de-stress. But if I'm not making money by it, then I can never reach my full potential of happiness because there's still that void there. So here, if you do what you love and you do what the world needs, that's your mission, which is great, right? So you found your mission. But still not making money on it, right? So, you have to figure out how to monetize your mission. What are ways that I can, kind of monetize it and be happy and live comfortably with that. So that's what it, delight and fullness, but no wealth. Vocation, that's when you're doing what the world needs and it's something that you can be paid for. So an example of the vocation would be like a college professor, right? You're being paid pretty well. You're doing something that the world needs because you're educating the next generation of professionals. But a lot of times you end up doing the same things over and over again, right? You teach the same classes and it all just becomes so routine and mundane. And so, you have to find different ways to kind of challenge yourself and make sure that for that reassurance that, this is where I'm supposed to be. I'm in a good place and to kind of reignite that love that you have for it. And then if you're doing what you're good at, and you're getting paid for it, that's your profession. So, you're doing a job. That's essentially what it is, right? We've all had, I don't know if we all have, I know I have, had places you went to just for the job, just I need a paycheck and I can do it. They think I'm all right at it and I don't want to choke people while I'm there. And so I go through it and I do it. But, the void becomes, there's that emptiness feeling, right? Because I'm not doing something that I feel like the world needs and I don't love doing it. And so there's still that void there. So when it comes to, kind of filling that and finding your purpose, if you can hit in that middle ground, right, where you're hitting all 4 of these aspects meet, that's your Ikigai, that's your reason for being. And so that's the goal. So this is a diagram. I have a printable version that I give to clients and I have them fill out the bubbles and we kind of process through it. And move things around and talk about different things of how they're impacted by it and what's helpful, what's not helpful, and all that good stuff to make sure that to help them find just that. Any questions about it? It's a great concept. I think it's very helpful. And like I said, a lot of people that I've worked with have found some benefit in it. And so we're going to do one last intervention. I'm going to show you all. This is one that you can actually do it yourself right now. You can do it with your clients. I think they'll really find it helpful.
Well,
Whether your son of a bitch boss has you working late, or you're stuck behind a 105-year-old lady doing 7 in the fast lane, breathing exercises are a subtle yet manly way to combat stress and anger. Watch as I demonstrate. Close your eyes and take a deep breath through your nose. Feel the breath travel down your gullet and into your belly. Now, slowly exhale. Fuck. Again. Fuck.
Is that last look that he gives that did it for me. Funny thing is, actually, I played this with one of my clients, and we laughed hysterically, had a great time. But he does this. He like, yeah, I do this for real now. You know, and man therapy is like he's not a real doctor, obviously, right? He's not a real doctor, but you know, it's they put together different things that are helpful for men going through stress, and helping to normalize getting help in a funny way, using humor. I think we talked about earlier, right? How humor is often used as a means to deflect. And so this site has all different types of videos. They have a whole app and everything that could be helpful with that. So that is all that I have for you all today. Are there any questions, any concerns, anything that I can bring more clarity to that could for you all?
There is one question from Jennifer Aguado. Any suggestions for when a male client shares about something traumatic that happened to them, but they are very matter of fact about it? They say it, but they don't seem to want to go any further. In other words, it happened, but let's move on.
Mm-hmm. So you want, like I said, stay in the tail of the comment, right? So we don't want to push our clients to anything. We can ask follow-up questions. I think the natural thing to do is ask follow-up questions. You know, hey, you know, so how did that impact you? You know, how are you impacted now? You know, and you don't necessarily have to say emotionally. You don't have to go into the emotions of it all, but just asking, you know, all right, well, how did that impact you? How did you deal with it? How did you work your way through it? And if they're willing to open up and talk on that level, allow them. If they're not, then that's fine. You know, that's fine too. I just had a client yesterday. Every topic. So they came in, and he was, you know, you can tell when your clients are tired, right? He's usually somebody I see in the morning. He came in, it was about 4 or 5 o'clock yesterday. So I was like, all right, maybe you just had a rough day at work. So he came in, and we were just talking like, hey, you all right? Just kind of doing our check-in, and we talking, very short with everything. And so I was like, you know, well, what's going on? And I was asking about different aspects of his life, different things going on, family, yada, yada, yada. And every time we would start to go down the road, he was like, but I don't want to talk about that. I don't want to talk about that. And not today. I don't want to talk about it today. Okay, all right, cool. We got to talk about it. We'll go into something else, something related to finances will come up. You see, start to get elevated, but I don't want to talk about it. I don't want to talk about it. And this last time he started tearing up, talking about family. And he reeled it back in and like, you know what? I don't want to talk about it. I don't want to talk about it. So I said, it's fine. You know, we don't have to talk about it. I said, you know what? Let's just do a guided meditation. And so I put on a guided meditation, and we sat there, and it was a 10-minute guided meditation. And he cried for at least 9.5 minutes of it. You know, and I don't know what was said. I mean, I don't know what was going on internally with him. I don't know what the day brought, but I know that's what he needed. He needed to shed those tears. He needed to shed that emotion and that stress that he was experiencing. He needed to shed that. Really not none of my business what he was going through if he didn't want to share it. So as long as that was helpful for him, it's all I care about. And so, you know, going back, you know, something that we were talking about earlier, right? We don't have to have the answers. You know, we don't have to be part of that process as far as like, you know, forcing them to verbalize anything. Just being present and creating a space where they're able to work through whatever it is they're going through. And when he left, he apologized. He was like, you know, I know I was difficult today, man. I'm sorry. Yada, yada. I said, bro, you got to apologize to me. You know, you got, as long as you got what you needed and you're leaving here lighter than what you came, that's all I care about. And so just, you know, understanding that, you know what, allow our clients to go through their process, creating space for them to be open and open to their feelings and work through it in whatever way they see fit is important. Now, we do have to have some tools in our toolbox. All right, we you know, and what they say, you know, whenever you got a plan, you know, that's probably not what's going to happen, right? So a lot of times I come to sessions, I always have something planned. I'm like, all right, this is what I'm going to do during the session. This is what we're going to talk about. If it's like a dry session, they just don't have anything. Like, all right, this is what we're going to do. But like this, I can say, like, no matter what I asked him, he was going to get elevated and then he was going to shut it down. So like, all right, well, you know what? Let's just work through it. Let's work on self-regulation, you know, and so, you know, so that, I think that's something that can be helpful.
People who are interested in more adult language meditations, apparently Yogi Brian.
Yogi Brian. Okay, I'm going to look him up.
For adult language meditation. There's been a request if you could show a copy of the adult feelings wheel you use with men.
Sure can. Sure can. Give me a second. Let me pull that up. So if you go to feelingswheel.com, you will have that. Basic. Wow. So as you see, you have the foundational feelings here, right? You have bad, sad, all those things. And then let's say, so this situation made me angry. Okay, you made you angry. So which one of these words feel closest to what the situation made you feel? Well, you know, felt a little frustrated. Okay, you're frustrated when that happened, you know, so let's drill it down a little bit more. So I was annoyed. Really, I was just annoyed because you know, I didn't close my gas cap and my check engine light came on. And now I gotta wait to make sure that it's really not anything wrong with my engine. So, you know, just this allows, you know, like I said, just the verbiage to be more direct about what it is that one is experiencing.
Thank you.
Mm-hmm.
Dr. Harlow has shared that she is going to create a monthly meeting for mental health professionals, and I think her email is in the chat if anybody is interested. There's a lot of thank yous. It was a wonderful training. Thanks for a great training, valuable information, very informative. Everyone loves you.
Thank you all. Appreciate it. I might have to, I need that email. I don't know where you are, Dr. Harlow, but I need that information too. I may have to show up.
We would love to have you. You want to hear something that's really funny?
I do.
When my son was experiencing everything that he was going through, when he, you know, was transitioning from college to working in the entertainment industry, we actually emailed you. How funny is that? So I know you are busy, sir. I know that you are busy, and it is a good problem to have. But
It
definitely,
is.
we would love to have you.
Oh, thank you so much. I appreciate it. And obviously I didn't get back to your son, so I apologize if I didn't.
You don't have to apologize. As I said, that's a good problem to have, right? We can't touch everyone, but the ones that we do touch are the ones that we do want to ultimately, you know, impact.
So true. So true.
So just to remind everybody, we're getting a lot of questions about certificates and the PowerPoint. If you have not already, Dr. Riddick, if you could send a copy to Shanice, and then she'll make sure she sends it out. So what she will need is your first and last name, your email address, and she's also requesting that you put in your agency as well. And then once that has all been tallied up, you will get a certificate and a copy of this presentation.
Anything else for me or before we close out?
I don't think so. Does anyone have any additional questions, statements, comments, other than Everybody loved it. Great presentation.
Karen, I sent it to you. Who am I supposed to send it to?
Send it to me. I'm saying the email with the certificate and the link will come from Shanice Hatfield from Western Tidewater. It just isn't going to come from me directly. So Dr. Riddick will send it to Shanice, and then she'll send it out to everyone.
Okay, I sent mine to you privately in a message. Did you get that?
Yes, I will get all of the things that were listed in the chat. Will go directly to her. Yes.
Okay.
I was wondering if Dr. Harlow can put her email address or her contact information back in there for the mental health group.
Yes, ma'am, I will.
Thank you.
Thank you all for sharing your time with me this morning and into the afternoon. It's certainly been a pleasure. Appreciate all the feedback and everybody kind of chiming in as we help each other through this, and sounds like everybody's making some good connections. So I am very happy and pleased. So everybody have a great rest of the week, an amazing weekend, and I hope to see you soon.
Thank you, Dr. Riddick. Have a great day, everyone, and look for that email from Ms. Hatfield.
Okay.